Good evening, everyone. Once again, welcome back to the third day of Prithvika 2024 national level paper and poster presentation conducted by Team Ayurata. And we are still thrilled to continue your active participation. And before that, I would like to invite our respected faculty members and our dear participants. We welcome you all. So let's make today another inspiring and insightful experience. So now we can start. And before that, dear participants, the same thing. I just want to remind you that's your time limit. Your maximum time limit for a presentation is 8 minutes. And kindly do follow your limit. So first we can start with our paper presentation. For that, I invite Dr. Kanchan Ashok Chaudhari on the topic case study presentation for Asthisaushirya with Shodhan and Shaman Chikitsa. I invite Dr. Kanchan Ashok Chaudhari.
Good evening.
Good evening, Doctor. You're audible.
Yes, ma'am. Yes, ma'am. Ma'am, please kindly share with the slide.
Just a moment, doctor.
Good evening, doctor. Please start this.
Good evening, all of you. I am Dr. Kanchan of Chaudhari, Kajal scholar, YSC, Kodoli. Today I am going to present next slide, please. Hello.
Doctor, you're audible. Please continue.
Hello. Yes. Good evening, all of you. I am Dr. Kanchan Chaudhary, Chikitsa department. Today's my topic is case study presentation for Asthisaushirya with shodhan and Shaman Chikitsa. Next slide. Patient details. Name of patient, Shamrao Kadam, 68 years old, male, retired teacher. Next slide. The patient presented with complaint of bilateral upper limb and interphalangeal joint pain since 1 year, backache since 1 year, bilateral upper limb and interphalangeal joint stiffness since 6 months, bilateral lower limb pain and pain while walking since 6 months, and giddiness since 3 months. Next slide. Gradation. So first symptom is bilateral upper limb and interphalangeal joint pain. The gradation is normal activity 0 grade, 1 difficulty while activity with mild pain, second difficulty while activity with moderate pain, third difficulty while activity with severe pain, and fourth unable to perform activity. Next slide. Second symptom is bilateral lower limb pain and pain while walking, 0 grade, normal activity and walking, Grade 1, mild bilateral lower limb pain and mild pain while walking. Second, moderate bilateral lower limb pain and moderate pain while walking. Third, severe bilateral lower pain and severe pain while walking. And fourth, unable to walk. Next slide. Bilateral upper limb and interphalangeal joint stiffness. 0 grade, no bilateral upper limb and interphalangeal joint stiffness. Grade 1, mild bilateral upper limb and interphalangeal joint stiffness. Second, moderate bilateral upper limb and interphalangeal joint stiffness. Third, severe bilateral upper limb and interphalangeal joint stiffness. Next slide. Giddiness, grade 0, no giddiness. Grade 1, once in 2 months. Grade 2, twice in 1 month for 2 to 3 seconds. Grade 3, twice in 1 week for 3 to 5 seconds. And grade 4, twice in week with stopping of all activities. Next slide. अष्टविक परीक्षा नाडी 82 पर मिनिट मल सम्यक मूत्र सम्यक जिव्हा निराम शब्द स्पष्ट स्पर्श अनुष्ण दृग दुस्तर आकृती मध्य. Next slide. So, according to gradation, upper limb, bilateral upper limb and interphalangeal joint pain, the grade is 3. Bilateral lower limb pain and pain while walking, grade 3. Bilateral upper limb and interphalangeal joint thickness, grade 3, which are severe, and giddiness, grade 2. Next slide. So Purishadhara Kalatha एवं Astidhara Kala, that is Asti and Vas are both Ashaya Bhav. When Vasvruti happens, Astikshar is seen. Pittadhara Kalatha एवं Madhyadhara Kala, Mahasthu Cham Madhya Bhavati, Madhya Nam Asti Madhyagat Sneha. Next slide. Nidan Panchak. So in this patient, the hetu is aharatmak pulses, hotel food, cold drink, and food. Viharatmak is long time शीत प्रवास सेवन, long time निशाकाली अतिसंक्रमण. पूर्वरूप सीनार, संधि स्थूल and graha, रूपा लक्षण as above mentioned. Next slide. संप्राप्ति, हेतु 7 which causes वात दृष्टि, संधि स्थानी वायु and आकाश भाव वृद्धि. मध्यसिंह अंशक्षय which leads to अस्थिखरत्व व पुरुषत्व वृद्धि. मध्यक्षय पूर्वक वात विकार and which causes अस्थिसौशर्य. Next slide. So the differential diagnosis for Asthisaushirya is for Sandhigatvat, in which Sarvasandhi Shodh and Shul is present, starting from big joint. Dosh and Dushya is Vat and Sandhi Pradesh Ato. In this Brahm Prachitanasi, it means there is no giddiness present in Sandhigatvat. Vat Rakta, Parva Pradeshi Pidika Utpatti, Vat and Rakta Dushti, starting from Jwar, starting from Parvasandhi. Brahm Prachiti nasti, Madhyakshay Lakshana nasti. In Amvat, sorry, previous slide. In Amvat, Vichik Danshavat Vedna, starting from Jwar, starting from big joints and Bahmutrata. So our Nidan is Madhyakshay Purvak Vatvika, that is Asthisaushirya. Next slide. चिकित्सा अस्ति आश्रयाणां व्याधीनां पञ्चकर्माणि भेदितं वस्तुतः क्षीरसर्पिः तिक्तकोपहतानि which is told by Charak and अस्ति संशयात जातान क्षीर घृते तिक्त संयुक्ते वस्तु निधि तथा mentioned in Ashtang Hruday. Next slide. So we started with Shodhan and Shaman Chikitsa. In Shaman Chikitsa, we have given the Pachasvati, which is 2 tablets for serious dose. Dakshadi Ghut 30 ml, which is Riktamashay at morning, and Guduchadi Yog Siddha Kshir 120 ml for BD dose. Next. In Raspachak Vati, there are contents Patol, Indraya, and Kuti, which helps for Deepan Pachan, Malanumak, Troto Rodnashan, Rasagni Vardhan, which leads to Tarata Dhatu Poshan Uttam, which leads to Asti Poshan. And Guduchadi Yog Siddha Kshir, which is 120 ml BD, is given, contains Guduchi, Patal, Mutta, Daruharidha, Vijaysa, Siris, and Raktachandan. Shodhan Chikitsa. Shodhan Purvakarma, Snehan, which is given by Dashmul Tel and Swedha, Grudu Peti Swedham, Basti Karma, Anuasan Basti, and Gulchadi Yogshir Basti, which we oil given by w.s.r Yog. Anuasan Basti 60 ml, which contains 4 types of tela, Dashmul Tel 15 ml, Brahmi Tel 15 ml, Nirgundi Tela 15 ml, and Bilva Tela 15 ml. Next. In Dashmul Tela, it helps for Dipan Pachan, Amnashak, Balya, and Sodagna. Brahmi Tel, Iktaras Pradhan, which is Medhya, Vesthapan, Rasayani, Ayushya, and Shodagna. Next. Nirgundi Tela, which is helpful for Vatshaman and Shul Nashan, and Bilva Tela, which is Shothar and Sandhan Karma. Next. So Bastidan Pram is given as Anvasan Bhakti 4 and Shir Bhakti 6. So on day 1, Anvasan Bhakti is given. On day 2nd and 3rd, Shir Bhakti is given. Day 4, Anvasan Bhakti. Day 5, 6, Shir Bhakti. Day 7, Anvasan Bhakti. 8 and 9, Shir Bhakti. And day 10, Anvasan Bhakti is given. And day 11, Hold Bhakti. So the symptoms which are previously present as severe come to grade 1 for bilateral upper limb and interphalangeal joint pain, which is normal. Mild bilateral upper limb and interphalangeal joint pain. Bilateral lower limb pain and pain while swelling, grade 1. Bilateral upper limb and interphalangeal joint stiffness, grade 0. And giddiness, grade 0. Next. Okay, thank you.
Thank you, doctor. So next I invite Dr. Samir Beloshe for the poster presentation.
Good evening to all of you. Myself, Dr. Samir Beloshe, PG scholar from Department of Shalakya Tantra in Yashwant Ayurvedic College, Kodoli, Kolhapur. My field of interest in Shalakya is ENT. So I'll be presenting a poster on obstructive sleep apnea, that is OSA. So OSA, that is obstructive sleep apnea, is a common disorder resulting from the collapse of pharyngeal airway during sleep. It is also known as snoring. Generally, people do not believe that snoring is a disease. Snoring is the sound made by the vibration of the airway during sleep due to the relaxation of muscles such as tongue, palate, and paratongue, that is your soft palate. Therefore, different parts of our body, like our heart, brain, eyes, do not get 100% of oxygen during a sleep. Many people suffer from apneic spells due to snoring. Snoring is also associated with many diseases. People who snore can suffer paralysis due to hypertension, heart attack, or brain stroke. Irregular sleep does not allow you to focus on your work throughout the day, as we all know. If you are driving, you and others may be in the risk of an RTA due to improper sleep. Patients with uncontrolled diabetes, hypertension get benefited if they undergo treatment for OSA. If children snore in their sleep, it may affect their physical and mental growth as well. Again, sleep apnea can be corrected by yoga abhyas, pranayam, weight reduction, and also OSA surgery, that is Z palatoplasty with tongue base reduction with uh, uh, with the radio frequency machine. So thank you again. Thank you, ma'am.
Thank you, doctor, for the short and interesting subject. So next, I would
Thank
like to
you.
invite Dr. Gauri Nilim Badhe. I
Yes, ma'am.
invite Dr. Gauri for the poster
Yes, ma'am.
presentation. Good evening,
Yes, ma'am.
doctor.
Good evening, ma'am. Can you please share my slide also?
Yes, doctor. Just a second.
Good evening, doctor. Please start the session.
Yes, ma'am. Slide share level. Uh, my slide is not shared. Okay. Okay, I will start my lecture. Good evening, everyone. Am I audible?
Yes, doctor, you're
Hello?
audible.
Okay. Thanks, ma'am. Good evening, everyone present here. I am Dr. Gauri Nilimbade, PG in SFM. I am glad that you all are attending my online poster presentation for pathya-apathya in Dantaroga. Now let's talk about pathya regarding dental care. Yav means barley, is Madhurasa and Madhurvipaka and Shitavirya. The properties of Yav is Guru and Ruksha. Means green gram is Madhurasa, Madhurvipaka and Shitavirya. The main property is Lagu. Kulatha horse gram is Kasharasatmak, Katuvipaka and Ushnaviryatmak. It is mainly Kaphavachyamak. Carvelak, bitter gourd, it is Laghu and Ruksha in properties, Tiktarasatmak and Ushna in Virya. Khadir, hardwood tree, is Raghu Ruksha in Guna and Tikta Kasha Rasatmak and Shitavirya and the Vipak of Khadir is Katu. Patol, pointed guard, is Tikta Rasatmak, Katu Vipaka and Ushnavirya. Jangal Mausrat is Shit and Laghu Gunatmak. The, all of these dravyas are Tridoshamak, mainly Kapavacchamak, and rich in antioxidant and antimicrobial properties. So it is useful for strengthening teeth and also early recovery of the teeth diseases. Nowadays, entire world dealing with apatya. So let's more talk about apatya. Anything which is take excess in amount and in wrong time, it become apatya. But in Dantaroga, the main apatyas are amla dravya. When we take amla rasa more in quantity in daily food, it causes shaithilya. It is harmful to teeth because it causes loosening of teeth. Matsya and Anuprasa have properties of Kaphavardhan, so it is harmful in Dantaroga. Dadhi is Abhishandi, so it causes digestive problems when taken in excessive amount and it is harmful for teeth. Kathin Dravya causes harm to teeth, so it is better to avoid eat hard food. Since back then, our acharyas used to clean their oral cavity and teeth with following dravya, which mentioned as Danta Dhavanartha dravya. Arka, Madar, Nagrod, banana tree, Khadir, hardwood tree, Karanja, Indian beech, and Kakub, Terminalia arjuna.
and mainly kashai, katu, and tikta rasatmak dravya. All are kapalnashak and Mukha shodhan. The size of this dravya is used. The size is kashta is 12 angul in length and width is kaninika agrasam. All these drugs help for Mukha shodhanartha. In Mukha, Bodak cup is present, which nourishes the danta, and all of these dravya acts on the Bodak cup. Acharya also mentioned Shrestha, supreme dravya, in Rasa. In Tikta Rasatmak dravya, Nimba is Shrestha for Danta Dhavan. And in Kashaya Rasatmak dravya, Khadir is Shrestha. In Madhu Rasatmak, Madhug is Shrestha. And in Katu Rasatmak, Karanja is Shrestha. In Dantaharsha means sensitive teeth and Dantachala means loosening of teeth. Acharya mentioned Tilakalkodak and Shukhoshna Jalgandush. In dental caries, Hingwadi Tel Gandush is very useful. And for straightening of teeth, Arimedadi Tel Gandush is very helpful. Okay, thank you. Thank you, everyone.
Thank you, Doctor. I invite Dr. Veenapani Arunkumar for the paper presentation.
Management of Mutrakrichchhra, urinary tract infection in female patients with Mutra Virechana by Punarnava Gokshuradi Yoga and Apana Vata Anulomana Chikitsa. So this is Dr. Veenapani Arunkumar, the co-founder of Sharma Ayurveda Vaidyashala, Jayanagar, Bangalore. So the introduction. Urinary tract infections. These urinary tract infections can affect the lower urinary tract when it is called the bladder infection or cystitis, and it can affect upper urinary tract when it is called the kidney infection or pyelonephritis. Mutrakrichchhra is difficulty in passing urine associated with pain and is of 5 types according to Charakacharya, namely Vataja, Pittaja, Kaphaja, Ashmarija, Shukraja, and Raktaja. Urinary tract infections are more common in women than men due to the female anatomy probably. More than half of the women population suffer from UTI at least once in their lifetime. Most clinics get cases of urinary tract infections and probably at the rate of 1 or 2 per week also, which requires immediate attention in some cases. Mutrakrichchhra can be correlated to the urinary tract infection in modern medicine. Epidemiology. It is seen in all age groups. Even infants, adults, and the old are affected by the UTI. The prevalence, 40 to 50% in women and about 0.04% in men. So 10% of women have recurrent UTI in their lifetime. There are more than 1 million hospitalizations per year with urinary tract infections in males and females. Incidence of UTI increases in old age. Usually UTI occurs in when it affects the kidneys also when it becomes more serious. Symptoms. Sometimes it's usually self-diagnosable. A bladder infection may cause pelvic pain, increased urge to urinate, pain with urination and blood in the urine. A kidney infection may cause back pain, nausea, vomiting, and fever. When bacteria enter the urinary tract through the urethra and begin to spread in the bladder, UTI occurs. Infection of the bladder. This type of UTI is usually caused by Escherichia coli. E. coli is a type of bacteria commonly found in the gastrointestinal tract, but sometimes other bacteria are the cause. For this case study, I have chosen UTI caused repeatedly by E. coli, wherein there was pain in the region of the bladder, lower belly discomfort, frequent painful urination, and blood in urine. So the urethra burning with urination, and there was also some discharge. The purpose of the study. The very purpose of this case study is to provide a safe, non-invasive, effective treatment mode, especially for women, young girls, and children in whom recurrences are common and frequent treatment with antibiotics can have dangerous side effects like liver disease and renal failure. Case study. Management of a female patient aged 23 years with recurring UTI. This is a case I treated in my clinic. The symptoms involved excruciating pain in the region of the urinary bladder, increased frequency of urination, painful urination and difficulty in urination. The color of the urine was red with blood in the urine. The cause was heavy medication for food poisoning about a fortnight ago, then dehydration due to less fluid intake. Urine examination was done in the laboratory, which showed presence of plenty of bacteria, RBCs, epithelial cells, and traces of albumin. The special investigation out of interest, I did it in my clinic. The Thaila Bindu Pariksha was done. About 25 ml of the
Hello.
urine was taken in a wide mouth dish.
Hello.
Hello?
Please continue, doctor.
Yeah. So 25 ml of the patient's urine was taken in a wide mouth dish. A single drop of thylam was added through a dropper and keen observation was made. So slow circular dispersion was observed and it was hence regarded as sadhya for treatment. See what happens in the laboratory. Sometimes you have each laboratory giving different results. And even if it is a urine examination or urine culture, the patient will be suffering a lot and it will take about 48 hours to get the test results. Yes. So the Chikitsa or the line of treatment followed was Vata Pitta Chikitsa. Here there was pain associated with the bladder fullness and all that. And there was severe burning micturition also with blood in the urine, which was again seen in the lab test. So the Chikitsa adopted was for both Vata, Pitta doshas and Vatanulomana and Mutra Virechana was done and regular Virechana was also done. So Mutra Virechana was done with 20 ml of Gokshura, Punarnava, Sariva and Amruta Kashaya taken in equal quantities with Khanda Sharkara and it was administered twice daily for 2 weeks. So classical preparations used were Gokshura di Guglu with the above Kashayam twice a day, Chandanasava along with Ushirasava 20 ml diluted with water twice daily after food. Then Pravala Pishti, 250 milligrams with honey and Chandraprabhavati with milk at bedtime. Sadhyo Virechana with Avipatti Karachurna, 20 grams with warm milk was given before starting the treatment. Snehapana, Varunadikrita, 10 ml after breakfast with hot water. And Triphala Kashaya was used to clean the external genitalia each time after urination. Necessary diet and preventing UTIs. So diet, pathya in this case is tender coconut water, lemon juice, grape juice, watermelon juice, rice, buttermilk, milk, rice kanji. Then apathya is hot, spicy, salty, sour diet, curd, fish, etc. So preventing UTIs. Drink plenty of water. Then usage of artificial creams and sprays to clean oneself has to be avoided. Visit the toilet before and after sex. Daily showers are a must. Conclusion. Urinary tract infections are the second most common bacterial infections. Women of all age groups are the most affected, probably due to the female anatomy. Recurrences are common and repeated antibiotic usage results in development of resistance to the same. Chances of liver and kidney failure cannot be excluded. Early detection and timely treatment with the above medicines can be of great help to the patients suffering from UTI. Thank you all. So the
Thank
reference.
you, doctor. Thank you for this
Yes.
outstanding performance. Please continue, doctor.
Thank you, madam.
Thank you, Dr. Veenapani. Next, I invite Dr. Kajal Morande for the paper presentation.
Yes, sir. Okay, myself Kajal Dhondba Morande, PG Scholars, Vastavritya and Yoga Department, SSAM, Hadapsar, Pune. My guide is Roma Gangaone, and my topic is literary review on role of pathya-apathya in the management of prameha, that is type 2 diabetes mellitus. Next slide, please. Introduction. Ayurveda is ancient science of life, health to maintain long, healthy life. It is aimed to prevent disease and maintain health status of an individual. Prameha is one of the Ashtomahaga described by Acharyas in Samhita, which means it untreatable disease when it lands into various complications. Acharya Bhagwat has described prameha as a frequent and copious urination with turbidity, that is prabhuta avil mutrata. Prameha Vyadhi can be correlated with type 2 diabetes mellitus in current scenario. Mellitus is the metabolic disorder of carbohydrate, fat, and proteins, characterized by chronic hyperglycemia due to absolute or relative deficiency of insulin. The prevalence rate of diabetes in India, estimate in 2019, shows that 77 million individuals have diabetes, which is expected to rise to over 134 million by 2045. Approximately 57% of these individuals remain undiagnosed. Majority of the cases are of type 2 diabetes mellitus, leads to multi-organ complication. This complication results to early morbidity and mortality. So early diagnosis of a disease and appropriate intervention by Ayurveda can prevent diabetes and its further complication. Faulty dietary habits and sedentary lifestyle are main cause for diabetes, so there is need to correct the diet and lifestyle modification. Next slide. Aim and objective: to collect literature of prameha disease from ancient textbook to understand and review the pathya-apathya mentioned in Ayurveda text. A material and method: literature collected from various Ayurvedic classic texts like Charak Samhita, Sushruta Samhita, Ashtang Hriday, Ashtang Sangra, and modern textbook along with research kit. Next slide. Literature review, prameha and its samprapti. According to Acharya Charak, idle sitting, oversleep, excessive consumption of curd, meat, soup of domestic, aquatic and marshy animals, and milk, new cereals and drinks, product of jaggery, and all other kapha promoting regimen are etiological factor for prameha. Kapha causes prameha by affecting medas, muscles, and body fluids situated in urinary bladder. Pitta, aggravated by Ushna Dravya, causes the same by affecting the above entities. Vayu, on relative reduction of other two doshas, draw on the dhatus in urinary bladder and thus causes prameha. Dosha produces respective type of prameha by reaching the urinary bladder and affecting the urine. Next slide. Pathya-apathya in prameha. In Ayurveda Samhita, Acharya describes three main pillars of life, that is Ahar, Nidra, and Brahmacharya. Ahar is one of the main pillars which help to maintain healthy life. Food is nourishing, gives strength immediately, sustain body, and promote lifespan. Pathya, a wholesome dietary regime, play a major role in restoring health. Pathya is that which is not harmful to body, that is dear to mind. According to Ayurvedic Hitopadesh, what is the need of medicine if patyahar is consumed, and what is the use of medicine if patyahar is not consumed? Therefore, Acharya Kashyap has termed it as the Mahabhaishya. In today's era, prameha is prevalent, can be correlated with diabetes, which is non-communicable disease seen as lifestyle disorder. In Sahita, Acharya have mentioned about pathya-apathya palan for the prevention and management of the prameha. Dietary and physical activity modification are important components. Next slide. Pathya-apathya ahar of prameha vyadhi. Ahar varga, that is shuk dhanya, contain yava, trunadhanya, godhum, kodra, uddalak, shashtik, shali. This must not be newly harvested as told as pathya, and apatya are shali, navadhanya. Then shamidhanya contain chanak, ahar, chanak, arhar, tuvar, and kulatha are pathya, and apatya are masha and nishpava. Mansa contain jangal mass, which is fatless. Example, mriga, which mass which is jangal in origin. Vishkir, pratud mass, and the mass which is roasted with the help of tandoor are told as pathya, and apatya are gramya mass, odak mass, and anup mass. Next slide. Then milk preparations are takra as pathya, and apatya payasa, and mandak kheer rice pudding, and mandak dadi. Then pana madhudak, sharodak, kushodak, trifada juice, sidhu, and madhuvika and madhudak are told as pathya, and apatya ikshurasa kshira and fermented beverages. Then fat and oils, सर्षप अतिसि दंती इंगुदी तेल अजामास शशक मास कपोत तितिर हरिण are told as pathya. Next, then fruits. Bilva, Bijapura, Tinduk, Amla, and Jambu are told as pathya, and apathyas mango, banana, papaya, jackfruit, and pineapple. Then vegetables, patol, shigru, methika, karvelak, karkati, and gojiva are told as pathya, and aluk is apatya. Next slide. Then pathya-apathya vihara prameha vyadhi. Pathya is a vyayam, asana such as Vajrasan, Paschimottanasana, Ardha Matsyendrasana, Halasan. Then pranayam, Kapalbhati, Bhramari, Bhastrika, Niyuddha, that is Pushti, riding on elephant or horse, Chakraman, adequate sleep for 6 to 8 hours at night, and apatya vihara, that is Asesuk, Swapnasuk, Madhyapan, Avyayam, Ratri Jagran, excessive shodhan therapy, and Diva swap. Next slide. Discussion. Prameha in today's era can be correlated with diabetes, which is a non-communicable disease seen as lifestyle disorder. In Ayurveda, Ahar, Vihara, and Yoga, etc. are described which have good role in prevention and management of the lifestyle disorder like diabetes mellitus. Major contributory factor for diabetes, sedentary lifestyle, and unhealthy diet. Poor controlled diabetes can be lead to several complications, and food can be a powerful tool in preventing or reversing diabetes. If someone adopt the diet pattern lifestyle according to the Ayurveda, it can be helpful in the decrease the incidence of prameha. The knowledge of Ayurveda for the prevention of disease can be revealed through the study of Ahar Vihar, which means through the lifestyle modification. Next slide. Conclusion. Preventing aspect play important role to cure disease along with medicine. Pathya-apathya may help to change the recurrence of the disease. Food is one among the 3 sub-pillars supporting the life. Disease can be cured without any medicine by just following wholesome regimen, whereas even 100 of medicine can't cure a disease in absence of wholesome regimen. No medicine are equivalent to food. It is possible to make a person disease-free with just proper diet. Thus, by altering one's diet and way of life, having understanding of Ayurveda's pathya-apathya can help one recover their health. Thank you.
Thank you, Doctor.
Thank you,
Next,
ma'am.
I invite Dr. Asmita Ravindra Baraskar. I
Yes,
invite
ma'am.
Dr. Asmita.
Yes, ma'am. Good evening, everyone. My topic is role of Panchkarma in management of Pakshaghata. Myself, Vaidya Asmita Ravindra Baraskar. I am from Darvagun Department, Hadapsar SSM Pune. My guide is Dr. Amita Baraskar, sir. Slide, please. Next slide. My topic is role of Panchkarma in Pakshaghata. Pakshaghata, major neurological disorder manifested as inability to move the group of muscles either left or right side of the body. It is considered as a Vata dosha predominant Vyadhi. Pakshaghata, where Paksha means half part of the body and Aghat means loss of function. Ayurveda literature is full of textual references where Pakshaghata is described extensively. Prognosis depends on many factors like Vay, Bal, Dosh involvement. Vata among the 3 dosh is considered as the controller of everything in the sharir. Vitiated Vata itself affects the dusha, which prevents the entire body on a part of it and give rise to different types of which is called as Vatvyadi. Vata Janito Sadharan Vyadhi, Vatvyadi iti, said by Madhav Nidan. The Panchakarma in Ayurveda is the treatment where there is treatment for root cause along with symptoms. Next. Vata has its 80 Nanatmaj Vikar, where Pakshaghata is one of it. Every Vyadhi has its own Samprapti. Likewise, Charka has explained the Samanya Samprapti. Dehe strotansi riktani purayitva anilobali karoti vividhana vyadi sarvanga ekanga samshaya. The Panchakarma procedure like Svedan, Vaman, Virechan, Shiro Virechan, Basti, Rakta Mokshan focus on the purification and detoxification of the human body. Panchakarma specifies Vat dosha, therefore, can manage the Vat Vyadis such as Gridrasi, Sandhigat Vat, Pakshaghat, Vat Rakta, etc. Thus, Panchakarma in Ayurveda is the treatment where there is treatment for root cause along with the symptoms. Next, Pakshaghat is one of the major neurological disorder manifested as inability to move the group of muscles either left or right side of the body according to modern terminology. Hemiplegia is usually the sequel of cerebrovascular disorder or stroke, and most cerebrovascular diseases are manifested by the abrupt onset on a focal neurological deficit. The clinical manifestation of stroke are highly variable because the complete anatomy of the brain and its vasculature. Other features where are weaknesses, decreased movement, control, and clones. Uh, Spasticity, exaggerated deep tender reflexes, and decreased endurance. Hemiplegia is the leading cause of disability, resulting in the enormous socio-economic implication. The term Pakshaghat, Pakshavat, and Ekanga Rog are synonyms of the same disease and are used in classical treatises in various contexts. Charak included this in the classification of Nanatmach Vyadi due to predominance of Vadya. The disease affects the Madhya Marma and Asti Sandhi and disturbs the function of Sira. Kandara. The modern lifestyle, dietary habits, lack of proper exercises, indigenous way of physical activities, and mental stress and strain are said to have definite role in the occurrence of Pakshaghat. Next, next, methodology. In Ayurveda, treatment of the disease is divided into two parts, Samshodhan and Samshaman. Panchakarma is a Shodhan Pradhan therapy which includes five major procedure therapy for Shodhan of the body. Along with it, there are many allied processes which helps in symptomatic relief by directly acting on the part being affected. This Pakshagat is best treated with Mrudu Samshodhan and Vatshamak Snehan Chikitsa. Disease review. According to Acharya Charak, it included in Vataj Nanatmach Vedhi treatment protocol of Pakshagat, which is described by Acharya Charaka and Sushruta, is Snehan Svedan, Mrudu Virechan, Budni Tailam, Shirodhara, Shirobasti, and Shirovirechan, which have the property like relaxing, soothing, and calming effects on the body and mind. It is observed that the Shaman and Shodhan Chikitsa is effective in Pakshagat. Next. Vagbhatacharya has incorporated Charakas and Sushrutacharya's Samprapti, and he claims the Vayu holds half of the body, dries up Sira and Snayu, loosens Sandhi Bandhan, and kills either half part of the body. Next, treatment review. Vata Samanya Chikitsa, Snehannasya Shirodhara, Basti, Alpasvedan, अल्पस्वेदन गृहणीय पदार्थ मधुर रसात्मक विरेचन स्नेहन स्निग्ध पक्षाघाते विरेचन Pranavayu Dushti is the foremost cause in Pakshaghat. The Pratilom Gati Vat has been treated by Virechan, which helps to restore Pran at its natural state. Sira and Kandara are the Upadhatu of Rakta, and Rakta and Pitta shares Ashray Bhav and helps in and hence Virechan is the treatment of choice in Pakshaghat. Thus Virechan helps in Samprapti Bhanga, but at the same time it may lead to Vat Prakop. Thus, Sneha Virechan is necessary. Eranda Sneha, Gandharva Haritaki, etc. can be useful. Next. बाह्य स्नेहपान, बलातैल, नारायण तेल, स्नेहन, स्वेदन with Nirgundi Patrasve, Dashamulkvat, Erandmulkvat, alternate Niruha Anuvasan Basti with Dashamulkvat and Tirthel is one of the important regimen in Pakshaghata. To provide strength to Indriya, Nasya will be a useful treatment. When Pakshaghat is Pittanubandhi, Svedan should not be given. Treatment should always be given with the approach whether it is Upastambhit or Nirupastambhitvat. Treatment protocol Snehan Svedan Nasyam Mrudu Virechan Basti. Next. Discussion. General principle of Vaddosha are adopted in the case of Pakshaghata, also specific treatment which is Nitya, Snigdha Virechan, Snehan and Svedan from first line of treatment. All the treatment combined with Basti improve the neuromuscular system and gives promising result in the form of extended stability and duration in standing of patients, improved grip and sense of touch as well as gain in muscle tone. Although Pakshaghata is difficult to manage, but treatment given in will will have in easy management. Nasya, Shaman, other treatment, other therapies, and pathya-apathya should be followed after Jaram, as repeated shodhan is mandatory in Pakshaghata patient. Next. Thank you.
Thank you, doctor. So
Thank
next we have a paper presentation, and for that I would like to invite Dr. Pramod Govindravu Shelke. Sorry, there is a poster presentation by Dr. Pramod Govindravu. I invite Dr.
Hello.
Pramod.
Hello.
Yes, doctor, you are audible. Good evening.
Hello everyone. Myself Dr. Pramod Govindrav Shelke. I am pursuing my PG in pediatrics second year. So I would like to present Asthma Shield Ayurveda style. The poster presentation is there. So what is the asthma? Asthma is a condition in which a person's airway become inflamed, narrow and swell and produce extra mucus, which makes it difficult to breathe. So we can correlate the asthma in Ayurveda with the tamak shwas, which is also tamak shwas is also called as a prana prapidak, in which the respiratory activity of the person or the baby increases, which also increases the heart rate of the patient, and which causes difficulty in the breathing to the person, to the patient. So the symptoms in the asthma are cough, wheeze, breathlessness, chest tightness, sleep issues, and fatigue. So what is the pathology of this asthma disease? The airway obstruction due to bronchospasm, edema, and mucus plug is there, in which in which we can say the Ig antibodies, which are released from the plasma cells, binds to the high affinity mast cells or basophils. When the pollutant or risk factors ingested by the patient, the mast cell releases the cytokines, which includes histamines, prostaglandins, and leukotrienes. These cells contract the smooth muscles and causes airway tightening, which causes the difficulty in the breathing. The risk factors are the risk factor includes allergens in or triggers which contains pollen grains, dust, pet animals, dog, cat, moles, as well as cigarette smoke, mosquito repellents, agarbatti, etc. In the modern, we can use the for the treatment short acting beta agonist, anticholinergic, and long acting beta agonist, in which terbutaline, formoterol, salbutamol, these can be included. In the Ayurveda, we can in the Vegavastha we can use Anuloman, Virechan, and Saindhavtel, as well as in Avegavastha we can use Gokshuradi Gugul, Madhumalini Vasanta. For the preventive measures, we use Bal Chaturbhadra, Ras, Chavanprash, and Suvarnaprashan. for the lifestyle, pranayam, ahar, vihar is can be improved for the patient. Thank you.
Thank you, doctor.
Yeah.
So next I invite Dr. Nishigandha Suresh Patil for the paper presentation on a topic, a review of literature on role of diet and lifestyle in Amlapitta. I invite Dr. Nishigandha Suresh Patil.
My name is Dr. Nishigandha Patil, PG Scholar, Swastharutta and Yoga Department from Sumtibai Shah Ayurvedic Medical College, Hadapsar, Pune. My guide name is Dr. Ramesh Ujwale, HOD of Swastharutta and Yoga Department. My topic name is a review of literature on role of diet and lifestyle in Amlapitta. Introduction. In the era of 21st century, the life of human being has become so fast due to increases in competition in the day-to-day life and activity. People having lot of heavy work, night duties, improper diet, time management regarding to diet, and also people are more likely attracted toward junk food like pizza, burger, etc. And these products are mainly reason behind the improvement of digestive power. In Ayurveda, suppression of digestive power are most like to term as Agnimandya, and which causes many more disease including Amlapitta. This disease mainly involves the Rasa, Rakta, Annava and Purishva Strotas. Its samprapti is mainly due to Prakopit Pitta, Vidradi, and by its own Ushna, Tikshna, Drava, Rasa and Amlaguna. Its incidence is increasing due to non-observation of Dinacharya, Ratricharya, Rutucharya and Saduruttariji, Viruddhahar, Apatya Sevan and distribute Trayupastambha, that is Ahar, Nidra and Brahmacharya. The line of treatment of Amlapitta by various acharya is divided into shodhan and Shaman Chikitsa. Shodhana mainly includes Virechan and Vaman. Shaman therapy mainly involves the use of Tikta, Madhur Rasa Pradhan Dravya, while pathya-apathya is also plays important role in Chikitsa of Amlapitta Vyadhi. Aim and objective. To review the importance of pathya-apathya and different yogic procedures are effective in management of Amlapitta. Material and methods. Information regarding pathya-apathya of Amlapitta Vyadhi is collected from various Samhita, that is Laghutrayi, Brihatrayi, as well as recently published articles, journals and PG theses are also becoming useful to review purpose. Literature review. Definition of Amlapitta. Chakrapani is in his commentary on Charak Samhita state that Amla Guno Uddhiram Pitta Amla Pittaha. Here Udrika stand for the increases, which means that there is a quantitative in Pitta. However, its Amla and Drava Guna is more vitiated. Hetu is आहारजन्य, विहारजन्य, मानसिक भाव, कालज भाव and आगंतुक हेतु. आहार हेतु is a विरुद्ध आहार, दुष्ट आहार, आम्ल आहार, विदाई आहार, पित्त प्रकोप आहार, also मध्य अति सेवन, intake of excessive water during food. In viharaj, immediately adivas of after food intake, living in Anupadesha, Varsha Ritu, in Manas Ritu having Manas dosha like Krodha, Shoka, Bhaya and Chinta. Kalaj Bhav is Agni is observed a week during the Vasanta and Varsha Ritu. And last is Agantuk Hetu. Lakshan of Amlapitta. Avipak, Kamla, Utpekshan, Aruchi and Gauri. Samprapti. Hetu sevan mainly includes Pitta Prakopak Ahar and Vihar, which causes increases in Amla Guna and Drava Guna in Pitta. Then Pitta become Vidhagga and Amla Bhava Utpanna. Then Amla Utkaradi Lakshana Utpatti, which produce Amla Pitta Vyadhi. Chikitsa. The line of treatment Amla Pitta may be considered in two ways. General principle of management and also management according to particular condition. According to Charak, also almost all disease may be treated in three ways. which includes Nidana Parivarjan, Prakriti Vidakta Chikitsa, and Apakarshan. Observation of Dinacharya, Ritucharya, Ratricharya, Sadarutta, and rules be followed according to lifestyle modification and recommended yoga, asana, Shatakriya, Pranayam, along with pathya-apathya. Pathya-apathya in Amla Pitta. First, list of pathya dravya found in various Ayurvedic Samhita for Amla Pitta. First is Annavarga. In Annavarga, Purana Shali, Yava, Godhuma, and Mukta. It's a Ahar Varga. Purana Shali is a Vata Shamak and Lagu. Yava is a Agni Dipana, Madhura Vipaki. Godhuma is a Lagu and Shitavirya. Mukta is a Lagu, Shitavirya, and Madhurija. In a Kshira Varga, Godugdha is Tridoshahara and Shodhahara. Shaka Varga, Patol and Kushmanda. Patol, that is bottle guard, it is Agni Dipana and a Kapha Pittahara. Kushmandu, that is pumpkin, it is a Madhur Vipaki and a Shita Virya. In Mansa Varga, Changam Mans, Laghu and Agni Dipana. In Phala Varga, Dadimba and Amlaki. Dadimba is a Madhur Rasa and Shita Virya, and Amlaki is a Tridoshahara and Nitya Sevaniya Dravya. Also, Gogrutta, Narikela Udaka, and Khanda Sharkara. Gogrutta is a Tridosha Shamaka. Narikela Udaka is a Shita Virya and Madhur Vipaki, and Khanda Sharkara is also Shita Virya. Second is a list of the apatya dravya found in various Ayurvedic Samhita. Varga, in Annavarga, Navanna, Mashu, and Kulatta. Navanna is a Guru, Ushnavirya, and Kafakara. Mashi is also Kafakara. Kulatta is a Ushnavirya and a Pittakara. In a Jala Varga, Dushita Jala and Shita Jala. Both are a Vata Kafakara. In Kshira Varga, Dahi. Dahi is a Kapha Pittakara and Guru. In Madhya Varga, Nava Madhya, new wine, it is a Ushnavirya and Vatakara. Kanda Varga, Aluka, that is potato, it is Vata Kafakara. Masa Varga, Masya and Anupamasa. Masya is a Abhishandya and Guru. Masa Varga is a Kafakara and Guru. Also, daily routinely thing to be avoided. First, avoid excessive use of spices, chili, and other irritating substances in food. Second, consume a food which facilitates the action of pathya-apathya, which will help to control the formation of ama. Third, dairy product, oil food items, salt, and sour food should be avoided. Consume of the incomplete of food items, that is viruddha ahara. It is better to avoid excessive water intake after consuming food. And six is the addiction of tea, tobacco, smoking, alcohol, which also plays an important role of etiology and aggravating factor also. Discussion. It is clear that Amla Pitta is mainly due to aggravation of Pitta, and which causes aggravation of Pitta dosha, should be avoided as far as possible, as Pathya Sevan has been mentioned in classical as equally important as Aushadha Sevana and as effective measures in prevention of disease and prevention of complication of disease. Amla Pitta occurs when Prakriti Pitta attends Vidagdha by the Aharaj, Viharaj, and Mansik Nidan. The diet beneficial to the body and mind are called pathya-ahar, whereas which adversely affect mind and body are called apathya-ahar. Conclusion. Ayurveda agrees that no medicine is equivalent to food. It is possible to make a person disease free merely with appropriate diet. Ayurveda does not regard Amla Pitta as a disease that can be treated by merely medicine or by a dietary regime. And the main key of treating Amla Pitta is to improve digestion. Through it is a Yapka disease. The prolonged use to the above pathya along with the treatment procedure will not only make a person free from Amla Pitta, but it also builds us the better health to live a long life. Thank you.
Thank you, doctor. Next, I invite Dr. Devendra Kamlakar Nijai for presenting the topic Managing Lifestyle Disorders, Diabetic through Ayurveda.
Hello friends, myself Dr. Devendra Kamlakar Nizai, PG Scholar, Rachna Sharir Department, Yashwant Ayurvedic College, Postgraduate Training and Research Center, Kodoli, Kolhapur. Today I am going to present Managing Lifestyle Disorder, Diabetes through Ayurveda, guided by Dr. Avinash Viprasar, MD Rachna Sharir, and HOD Madam Professor Dr. MD Rachna Sharir Department, YSC PG Training and Research Center, Kodoli, Kolhapur. Introduction. In today's world, we have a very busy life and dedicated by technology which causes us to become sedentary and inactive. So with this sedentary lifestyle, we eat a diet that is in high processed food, fast food, sugary beverages, all of which are bad for our healthy lifestyle. The condition in his body builds up sugar in the blood, and when unable to produce enough insulin because of pancreatic dysfunction is known as a diabetes mellitus. So most of the diabetes patients are on antibiotic medicines or insulin injections. It has become mandatory for them to go for these therapies, as diabetic condition can lead to multiple complications, retinopathy, kidney failure, and neuropathy. So to counterpart this and attempt to educate people about how to diabetes can be treated with Ayurveda along with yoga, exercise, lifestyle modification, diet, Panchkarma, and Ayurvedic medicines. In Ayurveda, diabetes is classified into 20 forms based on the dominant doshas in the body. This equates to 4 Vata related types, 6 Pitta related types, and 10 Kapha related types. If prameha is not treated, it develops into madhumeha or diabetes mellitus types 2. So, our aim is to study lifestyle disorder diabetes mellitus with Ayurvedic perspective, and the objectives is to study Hetu Lakshanas and Samprapti of Prameha Roga, and to study assessment criteria of diabetes mellitus. Materials and methods. So, the classical Ayurvedic text Charak Shushrut Vagvat along with its commentary are referred, and modern texts, articles and journals also reviewed. So these are the references, Ayurvedic references. And types of diabetes. Type 1 diabetes mellitus. The diabetes is an autoimmune condition in which the body immune system destroys insulin producing cells in the pancreas, causing blood sugar and glucose levels high, and urination is frequent, thirst is intense, and hunger is intense, and weight loss is rapid. In the type 2 diabetes mellitus, this usually happens as we get older or gain weight. Even though the body produces insulin, its sensitivity is reduced to a maximum in this situation, and it does not respond as well as it should. So, fatigue, vision disturbance, and slow wound and cut healing are all signs that are close to type 1. Classification. So based on causes, it is two types, Sahaj and Nimittaj. The Sahaj is genetic type 1, and the Nimittaj is wrongful because of wrongful diet, that is type 2 diabetes. The based on Doshadikya, there is a 20 Kaphaj, 10 Pittaj and 6 Vataj. And based on body types, these two large, that is obese persons, and the Krishna means lean. Krisha. Causative factors, that is Hetu, the inactivity, laziness, lack of exercise, already we have discussed, excessive sleep, excessive use of yogurt, meat and soup of domestic, aquatic and marshy lands animals, consumption of unmatured, non-aged grains, products of jaggery and sweets, all kapha promoting factors are the causative factors. And samprapti, the Agnimandya and Kleda Vruddhi, body tries to excrete in the form of urine, that is polyuria. Purvaru. So Purvaru, the pre-symptoms, just you can see the excessive thirst, dryness of mouth, profuse sweating, foul smell of body, feeling of something coated or heaviness in the hridaya, abnormal and frequent urination, burning, numbness in hands and feet, sweet taste in mouth, coated tongue, teeth. These are the purvarupa of diabetes. And the symptoms are frequent urination, increased thirst, extreme hunger, weakness and tiredness, loss of weight. So treatment, it is lifestyle modification is a very important. Physical activity and yoga should be added in our daily routine. Second thing, dietary modifications. The fiber diet, whole grains, garlic, onion, this are be added in our regular diet. Then Panchkarma should be done. Home remedies like amla, tulsi, ginger, gugul, neem should be taken. So ahar, bitter astringent foods are foods that help keep blood sugar levels in check. Barley, mung beans, and bitter gourd are all excellent choices. A specifying diet for the kapha dosha should be observed. It is helpful to consume a lot of cooked green vegetables. Any bitter plant or fruit seeds is edible. The vihara, increase activities, walking, jogging, swimming, skipping. Use stair instead of lift. Just 10 minutes of stairs climbing is equal to 30 minutes of walking. Use bicycles for short distances. Get involved in outdoor sports rather than indoor games. Minimize TV, mobile watching. Those with sedentary jobs can include at least 30 to 45 minutes of exercise daily. Avoid sleep during day. Then physical exercise, work out daily for 30 to 40 minutes. Yoga, very important. It makes a very big role. Many yogic postures produce stretch on the pancreas, which is likely to stimulate the pancreatic function, such as Dhanurasana, Halasana, Vajrasan, Bhujangasana, Naukasan, etc. संशोधन चिकित्सा पंचकर्मा, that is स्नेहपान महातिक्तघृत, स्नेहन with स्नेहपान, महातिक्तघृत, त्रिफलाघृत, धन्वंतरघृत. Then स्नेहन with massage, Til oil, Narayan oil, Swedan is contraindicated in prameha. Vamana with Madanfal, Vacha, Yashtimadu, Virechan with Aragvat, Gandharva Haritaki, Basti with Dashmul Kwat, Til Tel, Shirodhara with Til Tel, Ashwagandha oil. Shaman Chikitsa. Key herbal formulation like Amal ki, Haridra, Honey, Trifala, Guduchi, Arjun, Sagar, Haritaki should be used. Currently, we have superior drugs and also the purified form of long and short acting insulins to treat diabetes, but still resistance to these drugs in their maximum therapeutic dose is seen in increasing number of patients in the long term treatment. So apart from this, increasing complication in diabetes are seen in these days. That's why the essential now not only to treat diabetes mellitus but to prevent resistance to drug as well as prevention of complications. To achieve this goal, if we follow the therapeutic principles mentioned in Ayurvedic classical texts for treatment and prevention of disease, it will be very useful to achieve our goal. Natural remedy helps to increase metabolic rate, detoxification of body, and boost immune system, resulting to increase pancreatic function by production of beta cells, increase enough insulin production, and treat hyperglycemia. It has an abundance of essential nutrients and it completes the nutritional demand of the body cells. So, conclusion, most of the treatments of the Ayurveda like Panchkarma and Ayurvedic medicines are very useful to improve pancreatic functions and ultimately to reduce blood sugar level. Even some herbs which we use in our daily kitchen are very useful to avoid diabetic complications. So regularly use these herbs in our intake. This article will help people to know about Ayurvedic management in type 2 diabetes mellitus. Awareness of such modalities is necessary to overcome fear of diabetes in community and ultimately to reduce mortality rate due to diabetes. Thank you.
Thank you, doctor.
Okay, next I invite Dr. Nikita Rajesh Sonune for the paper presentation.
Good evening, sir and ma'am. I am Dr. Nikita Rajesh Sonune, postgraduate student from Vidarbha Ayurved College, Amravati, and my guide name is Dr. Sanjay Sokkar, sir. My topic is a review study on role of Abhyanga in Dincharya. Introduction. Abhyanga is one of the Dincharya Upakram and it is an ancient Indian Ayurvedic approach adopted for healing, relaxation, treating various diseases. It is an Ayurvedic, holistic, synchronized massaging of the body towards the movement of blood, basically within the way of hair growth. Abhyanga could also be done using oil, herbal powder, herbal paste, or ghee. The massage strokes are long and flowing to stay the blood warm for maximum absorption of medicated oil. This helps to reduce your body fatigue and knots within the muscles. Here's what one says. Give yourself a full body massage every day. It's nourishing, pacifies the doshas, relieves fatigue, provides stamina, pleasure, and excellent sleep, enhances the complexion and luster of skin, promotes longevity, nourishes all parts of the body. Vakbhatacharya stated that Abhyangam Acharit Nityam. That is, Abhyanga should be done regularly. Next slide, please. Objectives to study the role of Abhyanga as a Dincharya Upakram. Material and methods. Next slide, please. Slide, please, sir. Classification. There are mainly three types. According to scientific methods, two types, Ayurvedic massage and Swedish massage. Ayurvedic massage is away from heart or in the direction of the artery, and Swedish massage towards the heart or in the direction opposite to artery. According to material use, medicated powder, oil, or medicated pastes are used. According to movement, two types, dynamic and static. Next slide, please. Contraindications, patient who were taken Panchkarma procedures recently like woman, Virechar, in state diseases. Patients of fever and indigestion should never be anointed. General contraindication, high-grade fever, severe kidney and heart diseases, deep X-ray therapy, osteoporosis, severe spasticity, and excessive hairs on skin. Local contraindication, acute inflammation, skin diseases, recent fracture, severe varicose veins, atherosclerosis, thrombosis, malignancy, open wound, and poisonous foci. Next slide, please, sir. Method of Abhyanga. The Abhyanga are often done either in standing, sitting, or lying position. Massage should be wipe out the direction of hair within the palms. Early morning massage with slight warm oil should be started by applying little amount of oil on the scalp and massaging the top gently. The open palms of the hands Therefore, the flat surfaces of the fingers should use instead of fingertips for the entire massage. The massage should be in circular way so as to stimulate the marmo points, which influences all the parts of the body. Massage the face and therefore the upper part of the back and flat surfaces of open palms and fingers. Massage the arms vigorously. For the joints, use a circular motion for massaging then gently massage the chest, stomach, pectoral areas. Massage the legs in a circular motions for joints and straight motion for long bones. The massage the feet both should be done with lukewarm water. Discussion. According to Ayurveda, oil used for massage doesn't have their actions confined to skin alone. The drugs within which these are boiled permeate through the skin and reach different tissue elements of the body. The medicated oil used for massage remain within the skin for 300 seconds and gradually and consequently permeates through med, asti, majja. The medicated oil takes about 100 matras each to influence and permeate through the different categories of tissue elements. Benefits. In words of adulthood, exertion, aggregation of vata, improve vision, nourishing to the body, long life, good sleep, good and healthy skin. One who practices oil massage regularly, the body becomes soft, controls vata, cough, aggravation, and bestows nourishment to the tissues, good complexion and strength to the body. Next slide, please, sir. Conclusion. Abhyanga is one of the procedures in the Dincharya to maintain health and prevent diseases. Ayurveda says Abhyanga should be done daily, if not possible every day. At least apply oil to head, ears, foot. It must lead a healthy life, showing the importance of massage to important parts such as sheath, Shravanendriya, and path. Hypothetically, it can be concluded that Abhyanga should be done for 5 to 10 minutes daily as a part of Dincharya and treat any condition depending upon the strain, age. It will help in longevity of life. Next slide, please, sir. Thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Pradima, and Dr. Pradima, we are extremely sorry for the inconvenience because our technical team lost the network connection. That's what happened.
Okay, ma'am.
So
Yes, ma'am, no problem. I'm
so
audible.
you can... Yes, doctor, you're audible.
Okay, can you please share my PPT?
Sure, doctor.
Good evening, all of you. My name is Dr. Pratima Dose, PG scholar from Department of Dravyagun Vigyan, SSM Hadapsar. My topic of today presentation is controversial drugs, that is Sandigdha Dravya in Ayurveda. Next slide. Content. Here we can see the introduction, causes of the controversy, how to study the controversy, method to study the controversial plants, and some of the controversial dravyas in Ayurveda. Next slide. Need for the study of the controversial plants. For the proper identification of dravya, to reduce the adulteration, due to the excess demand of the market, there is a adulteration we can see in the market. To avoid this adulteration, we need to study the controversial plants. The need of the plant controversial drugs to study is improve rational use of the dravya in the part of the treatment, especially in ekal dravya chikitsa. Next slide. Introduction. Sandigdha Dravya. Sandigdha Dravya means controversial drugs, which are the drugs which possess the controversy related to their identification by means of nomenclature. The word controversy coined from Latin word controversia. Contra means against, versus means to turn. Controversy is a state of the prolonged public debate or dispute. In Ayurveda, we have seen such debate in the form of Tadvid Sambhasha for confirmation of some basic principles. Controversial plants, that is Sandigdha Dravya, is a term used for medicinal plants having the controversial botanicals as the sources, appear in the ancient Indian literature. In Ayurveda system of medicine, treatment is based on Chikitsa Chatushpad. For that, we need to study the controversial plants. Next slide. Causes of the controversial drugs. First cause, disruption in the traditional teaching and training. Vedic period. Single name is based on the morphological characters and utilities. Post-Vedic period. Teaching method involved the Gurukul Parampara, started giving more than single names and local names. Commentators compile from the more than one source and also start giving one name and becomes additional names known as Parayanam. This causes the controversy in the plants. Documentation defect in manuscripts. In past, there was no printing machines. Acharya had written the manuscript on the Bhurjapatra, Talpatra, and other substance. During the copying of these manuscripts by the editors or translators, mistakes might have occurred, which ultimately leads to controversy. Example, Talavriksha of Dhanvantari Nigantu has become Lata Vriksha in Nigantu Shesh. Next slide. Single synonyms is used for multiple plants. That is, Hemavati is used for Vacha as well as Haritaki, Amruta. Guduchi and Haritaki is named as Amruta in most of the Nigantu and as well as Sanhitas. Madhuparni is used for Gambhari and Guduchi. Geographical verification. India, that is the country which is a multi-diversity, having the high Himalaya to sea level, world's highest rainy area to the third region. That's why every area has its own type of plant diversity. The plant which is found in the northern India may not found in the southern part. So due to the unavailability of these species, other species are used for the same purpose. Example, Convolvulus microphyllus, that is Shankhapushpi, as used in the northern India, and Clitoria ternet is used as a Shankhapushpi in southern part. Next slide. Poor understanding of Sanskrit word in different constructs. Ayurvedic classics are mainly in Sanskrit language. Same word in different construct gives different meaning, and due to the poor understanding of this type of words by commentator further creates controversy. Example, we have taken the people, which is used denotes the Bodhi Vriksha when used in male genders, and same in female gender is denotes piper. Next. Previous slide, please. Parallel evolving knowledge system, identifying species and naming them with similar or fully similar properties, inherent qualities of ascent may create controversy. That is, Brahmi is mentioned as Medhya Ayurvedic and Manduparni is another Medhya Rasayan in Charak Samhita. That is, Bacopa is source of Brahmi in northern India, and Centella asiatica is used as Brahmi due to the similarity in therapeutic effects. Vernacular names. Somewhere, same name is used in a different language, but having the different meaning and identity, which also a cause of the controversy. Matila in Tamila is Punica grantum, whereas in Kannada, Citrus medica is used for the Matila. Next slide. Non-Ayurvedic literature. In poetry, Kamal, Utpal, Kumud, Kalhar are referred as the same plant, that is lotus, but botanically they are different species. Polynomial nomenclature. Multiple name for the single plant. Different Nigantu written by different authors gave multiple name for the better understanding, but they created controversy later. Next slide. Here we can see how we can study the controversy. Knowledge of the Ayurvedic classics is the main part of the studying the drugs. Sound knowledge of Sanskrit language and knowledge of the modern botany is as well as important in this factor. Field survey and excursion tours to differentiate the plants is also useful. Historical view about the plant source to differentiate is also useful. Geographical knowledge of pharmacognosy and phytochemistry related to the Indian literature like Vedic sculptures and imagination power. These are the points we have to use. Next slide. Methods to decrease the controversy. Collect textual information, which should include the etymology, that is nirukti of the dravyas, synonyms, paryay, clinical application, that is chikitsatil upyog, chronological difference, collect living traditions, market study of the controversial drug is a main factor we should have to study. Pharmacognosal approach, which involve the specific and that is histological identification as per the TS of the part of the plant and by comparing it with the API guidelines. Next slide. Botanical identification. As per botany features of a plant part, which is used, that is the leaves, stem, venation pattern, and smell, we can identify the different dravyas. Taxonomical identification. As per nomenclature, classification, characteristic, and morphology, we can study the controversies. Next slide. Some of the controversial dravyas in Ayurveda. Daruhidra is the drug where we can see the controversy. Berberis aristata and Cocinium fenestrum, these are the drugs which can be seen in the Sanhitas. Brahmi, Bacopa moneri, hydrocortic asiatica, and Monera crucinate. These are the controversial drugs for the Brahmi Dravya we have found in the Sanhitas and other places. Amarvel, Cusqueta reflexa, Casentha filiformis. These are the controversies for the Amarvel. Next slide. Punarnama, Tranthum particulastrum, Borevia diffusa. These are the controversies we can see for the Punarnama. Jivanti, Leptadenia reliquata, Desmotricum fibratum, and Semifuga fetida. These are the controversies for Jivanti. Shankapushpi, Convolvulus pluricalis, Evolvulus aslenoids, Cansoria decasata, and Clitoria ternata. These are the controversies for the Shankapushpi. Next slide. Thank you, everyone.
Thank you,
Thank
Doctor.
you, Doctor. So, next, I would like to invite Dr. Deepthi Ramdao for the paper presentation. I invite Dr. Deepthi Ram Rao.
Yes, ma'am. Can you please share my PPT?
Yes, Doctor.
And Dr. Deepthi, please start the session, Doctor.
Yes. Good evening, everyone. Myself, Vaidya Deepthi Ramrao Mallik from Samhita and Siddharth Department from BSDT Ayurved College, Wagholi, Pune. I am going to present my topic under the guidance of Dr. Ranibala Nimade ma'am. The topic of my presentation is Understanding Key Concepts of Trivida Kukshe Vimanadhyay and its importance in Chikitsa. Next slide, please. Ayurveda, the science of life, is probably the first medical science which gives importance to the ahar, both in maintenance of health. And now, the definition of health is explained in Ayurveda as a swasthya, as a samadosha samagnischa samadhatu malakriya. And today, we specially focused on the samagni. Associated with the proper function of Agni, we can understand the concept of arm explained in the Grahani Chikitsa as Dushakti Agni Sadushtonam na tat pachati laghuapi. What is it? The vitiated Agni does not digest even a lighter food. Next slide, please. Therefore, for balanced diet, Matravat Ahar is very important and which is explained in the Trivida Kukshe Vimanahar. Also, the concept of arm, that is Samatva, Niramatva, Lakshanas, types, and Chikitsa Sutras are also explained in that Adhyay. The main aspect of that Adhyay is that in this Kukshi, which is divided into three parts, are elaborated very properly. That is, one part should be filled with solid food, second part with liquid food, and one should be left for Vata, Pitta, and Kapha. Next slide, please. Aims and objective. Aim is understanding the key concept of Trivida Kuksha Viman and its importance in Chikitsa. The primary objective is to study the concept of Matravat Ahar from Ayurvedic classical texts, and other objective is to study the importance of Am and its Chikitsa from Trivida Kuksha Vimanadhyay of Charak Samhita. Next. Material and methods. Material, the information extracted from the classical texts that like Charak Samhita, Sushruta Samhita, Ashtang Hridaya Samhita and their commentaries. And method, reading and understanding the concept of Ahar and Agni from this text. Also, the understanding the concept of Am, Agni Dushti and Ahar Matra. Also, elaborating the Am concept with their Lakshan types and Chikitsa. Because lastly we concluded the concept how Ahar Matra is Agni Bal Apekshini and how Ahar becomes the cause of Agni Dushti, which is going to be lead the Amotpatti as a Vyadhi Hetu in several diseases. Next slide. To decide the ideal ahar matra, for that Charkacharya explained the lakshanas as matravat ahar lakshan, amatravat ahar lakshan. Amatravat ahar lakshan has also subdivided into hina matravat ahar and adhik matravat ahar. And for that they some lakshanas as matravat ahar lakshan like kuksheprapidam aharena, hrudayasya anavarodha, parshvayopitanam, etc. And also explain the hina matra and adhik matra lakshanani. Next slide. Agni plays an Jataragni plays an important role in digestion. So we here understanding the types of Agni according to the Bala. That is Tikshnagni, Mandagni, Samagni and Vishamagni. Next slide. Now, how Agni get vitiated for the specific hetus and are mentioned in the Samhitas. They are like Abhojanat, Ajirnat, Atibhojanat, Vishamashanat and etc. So many lakshanas are explained in the Samhita. From this vitiated Agni, from these, the last two lines we understand from the introduction, that is vitiated Agni does not digest even a light food. This undigested food that is called the Shuktatva and it works like as a poison in the body which gives rise to the several diseases. So, Agni Dushti Hetus plays an important role in the digestion of food. Next slide please. The role of Dushtagni in manifestation of the Vyati, that is Amotpatti. The Amanirmiti, that is the Yati Annam Visharupatam, is the main condition prone for all diseases, is caused by the Agni Deshtu Hetu. For that, Chakrapani says that Visharupatamiti Yatha Visham Bahu Vikarakari Bhavati Tatha Tadrupatam. And also, the same reference has been found in the Sushru Samhita as Amam Vidagdam Vishtabdam Kafa Pittani Lokramat Ajirnam Kechidyat Chidnam Chaturtam Rasasheshata. Next. Now, the Amaprakopa Hetu mainly divided into three parts as a Atimatra Ahar, Ahariya Hetu and Manas Hetus. For that, Ahariya Hetus are like Guru, Ruksha, Shita, Shushka, Vishtabda, Vidahi, Asuchi, Viruddha and Akali Ahar. And Manas Hetus like Kama, Krodha, Lobha, Moha, Irsha, Shoka, Mana Udvega, Upatapta Manasa, etc. For that, from the commentary of Chakrapani, they also explain the term of Am as a Amam Pakvam Sadushtam, Dosha Samurchana Janitam, Dushayanti Tadneyam. That is, he also explained that it prones to the several diseases. Next slide. Now, the Lakshana of Am, for that the term Annavisha Lakshana is explained in the Charak Samhita and also the Lakshanas are explained in the Ashtangrudaya Samhita in the 13th chapter. They are like the Vishtamba, Sadana, Shiroruka, Murcha, Pushtigraha and etc. Next slide. Now, the types of Amadosha are Visuchika and Alasak. What is the Visuchika? That is Urdhvam Adascha Pravrittim Adoshaha. And the Alasak is the Pradushtam Apaddham Maryak Tiryak Gatam Cham Kajatit Kevalam Shariram Dandavatam Stambhayati. And now, the concept of Amavish is explained. That is, if person do the same hetu repeatedly, that is the word used, the Shilanaha, it prime to condition like the Amavish and it shows the lakshanas like the Visha Sadrusha Lingatvat. Next slide, please. Now, the Chikitsa Sutra for Amadosh Chikitsa is to protect the Agni, Ahar should be in Matravat. Now, the Ahar must be accordingly to the Ahar Vidhi Visheshayatan and Ahar Vidhi Vidhan. In the condition of Am, that is the special Chikitsa has to be done. For that, Amadosh Chikitsa Sutras, for that Avastik Chikitsa and Samanic Chikitsa has been done. Avastik Chikitsa like the Alasak Chikitsa. In that, Pradushti Bhutam, Alsi Bhutam, Ullekayat Ado. That is the Sadhya conditions has been explained. And now what is the conditions for the Sadhya that reference has given in the Ashtangrudaya Adhyay, that is Tatra Utklishte Samutklishte Kafa Praya Chalemale. And along with that, the symptoms like Rullas, Prasek, Annadvesh are explained. In that condition, Sadhya has been given. Next slide. Along with that, Svedan for the dosha vilayan, Varti Pranidan for the anuloman of the doshas and Upavas for the Shesha dosh Pachanartha. Next, the Visuchika Chikitsa. In Visuchika, the firstly Langhan is given. After that, it follows the same treatment protocol like the Viriktavat patients. Thereafter, Amado Chikitsa is given. For that, firstly, we have to do the Hetu Viparit Chikitsa, then Apatarpan. Now, the concept of Apatarpan explained in Charak Sutra and also the Chakrapani give the elaboration of this Apatarpan, like the Doshanam Amatakshayam Suchayati, and same reference given in the Ashtangruda Hemadri, that is Apatarpana, that is Langhanat. Thereafter, we give the Vyadhi Viparit Chikitsa and Hetu Vyadhi Viparitarthakari Chikitsa. Next slide. After doing that, all Chikitsa Upakarmas for Shesha Dosh Pachanartha, Niram Dosh Chikitsa is mentioned in the Samhita. For that, the Chakrapani has mentioned that for Vyadhi Janita Ati Daurbalyadi, Dosha Prashamanartham. What is that? That is the Abhyanga, Niruha Basti, Astapan Basti, and Snehapan. For the Snehapan, the specific avastha has been mentioned, that is the Vatopittattara avastha, mentioned in the Charak Samhita Chikitsa 3, Jwara Chikitsa there. Lastly, doing all those chikitsas in patient, how we decide the dosh sthiti and bhojanasya kalen rukna. For that, there is a specific lakshanas mentioned, that is prasrutre vinmutre rudhis vimale up to the vidhi niyamanam kala sahimataha. That is the right time to eat the food in the matra. Next slide. Lastly, what we conclude, the measurements of each division of Pukshi cannot be standardized as it is depend on the trupti of individual. Matra Purvak Ahar is the main cause of production of Ahar. The knowledge of Matra Purvak Ahar with the Ashtahar Vidhi Visheshayatan help in maintenance of the health and the getting rid of various diseases. Next slide. The purpose of Ayurveda is Swasthasya Swasthya Rakshan and Aturasya Vikar Prashanam. That is, it has been described in terms of healthcare, that is, it is necessary to control the diet first for the healthcare. Thereafter, Ahar Matra Puna Agni Balapekshini. That is, it depends on the Agni Bal and Agni Dushtikar Hetu, which is the root cause of all diseases with Amodpatti. That is, almost all diseases arise due to the Mandagni. Along with this, the Ahar Matra will be different for everyone according to the examination of the Dashavida Pariksha Bhava, that is Purusham Purusham Viksham. And finally, hence we conclude that is, one should consume daily the food which promotes the health, that is sustain the health and which does not lead to the disease condition, that is Taccha Nitya Proyunjitam Swasthyam Ena Anuvartate Ajatanam Vikaranam Anutpatti Karam Chadat. Next slide. Thank you.
Thank you, doctor.
Excuse me, ma'am. Please take my presentation. I am waiting since 6 p.m.
Doctor, are you Priyanka? Priyanka,
Yes, ma'am.
doctor, your allotted time is after 8 o'clock, right?
No, but it was not given to me.
You
I
didn't
am
get
not aware about that.
You didn't get the time slot?
No.
Okay, doctor, please wait.
Dr. Priyanka, we will call you next, doctor.
Okay.
Okay, doctor. And next I invite Dr. Charishila Nagawade for the paper and poster presentation. Dr. Charishila, are you there? Dr. Charishila, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
And dear participants, I'm continuously trying to remind you the same thing. Your maximum time for the presentation is 8 minutes, and try to present your presentation within the given time period. Thank you.
Hello, sir.
Yes,
Hello.
doctor.
Sir, I have already shared my PPT. Can you please share it for me?
Okay, doctor, just a second. And please start the presentation, doctor.
Yes, sir. Can I start?
Sure, doctor, please start.
Good evening, everyone. Myself, Dr. Charushila Balasaheb Nagode, PG Scholar, third year from Komarvritya Department, from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Next slide. Introduction. My topic is the mode of action of Shirish Twakchurna in the management of childhood asthma in children. First, I am going to give introduction. The problems of children differ considerably from those of adults from the point of view different nature and type of many diseases entities as well different diagnostic criteria and medical therapeutics. Air, water and food are imperative to survival of life. Air is key of importance. Respiration or breathing in and out is the evidence of life. The function is very necessary to derive the happiness and benefit of one's life, and it is carried out by pranavaha srotas since the time of immemorable. Man has been in steady attempt to find the solution of the life-threatening and distressing disorder which affect the human race. One of the such condition is stomach shwas, that is bronchial asthma, causing an impediment to one's respiratory function. The prevalence of asthma is increasing, especially in children. Annually, the World Health Organization has estimated that 15 million disability adjusted life years are lost, and 250,000 asthma deaths are reported worldwide. That is globally strategy for asthmatic management and prevention. On the basis of clinical symptomology, bronchial asthma appears very close to the stomach shwas described in Ayurveda literature. Next slide. Stomach shwas has been described elaborately in both Bruhatrayi and Laghutrayi, which indicate its importance as a disease. Especially in Charak Samhita, the detailed description of Shwas Rog is available, which is incorporate its etiology, pathophysiology, and elaborate the therapeutic modalities. In Ayurvedic text, the 5 types of Shwas Roga are described, that is Mahashwas, Urdhva Shwas, Chinna Shwas, are said to be incurable. Shudra Shwas is produced due to exertion and relief on rest. Tamak Shwas is said to be yapya and curable in early stage. So the management described for Shwas Rog in Ayurvedic literature is mainly applicable on Tamak Shwas. My criteria for selecting the drug is Vata Kapha Shamak to the view of doshas, Kasa आणि श्वासहर drug, कफ निस्सारक drug, स्वर्य drug, शोतहर drug, स्त्रोतोशोधक drug. The drug should not be ushna, tikshna and katu, that child cannot tolerate it because of its avipak dhatus. It should be easily available to the child. So, weaving above point, Shirish Twakachurna may be great result in the therapy of Tamak Shwas. Description of Shirish. First, Dhanvantari Nigantu. The guna of Shirish as per Dhanvantari Nigantu is Laghu. Rasa is Tikta. Dhanvantari Nigantu didn't give the vipak of Shirish. Virya is Ushna. Then Kadai Nigantu. Guna is Laghu and Tikshna. Rasa, Madhur Tikta Kashai. Vipak is Katu. Virya is Anushna. And it is Tri Dosha. Ratnakar Nigantu. They didn't give the guna. Rasa is Katu. Virya is Shita. And it is Vatahar. Bhav Prakash Nigantu. Laghu guna. Madhur Tikta Kashai Ras. Virya Anushna. And that is Tri Dosha. Probable mode of action of Shirish. Ayurveda emphasizes on Strotorod in the manifestation of Shwasarog. Strotorod is the resultant of disturbance in the equilibrium of Vata and Kapha. Hence, drugs which are beneficial in removing the obstruction and maintain the physiological equilibrium of Vata and Kapha are useful in this condition. The pharmacokinetics properties of the drug, that is Shirish, as per Ayurveda, will be beneficial in counteracting that exacerbated Kapha and Vata dosh. By virtue of Tiktaras, Katuvipak, and Laguguna, the drug shows Deepan and Pachan properties. The Agni Deepan and Pachan function boost the metabolism and diminish the formation of armor. This property of drug is vital in preventing the disease. Madhuras is said to be increase all the Sharir Dhatus, Mana, Indriya, elevate Vata dosh, and increase the vital strength. Kapha Vipak increase the overall metabolism. This increases the quality of Rasa Dhatu and thereby the entire status of the body. Shirish, by virtue its Lagu and Tikshna gun, has Kapha Nissarak and Strotoshodhak property, so it decreases the spasm of bronchi. Shirish has the property to inhibit the histamine release, which obstruct the immediate hypersensitive reaction and prevent the histamine, as will acetylcholine induce bronchospasm. That is mentioned in Tripathi book. The immunomodulator activity of the drug is already described in drug review. As per related study, the researcher has concluded that immunomodulatory regimen will play a key role in future therapies for the allergic diseases. These treatment modalities may not only treat allergic disease but also beneficial in reducing morbidity and mortality for which it is responsible. Shirish has Shotahar, Vishagna, Vedana Stapan, and Shwasahar property, which reduce the symptom of asthma. By virtue of Vedana Stapan property, it reduces the chest pain during coughing. Relief in dyspnea and wheezing were because of reducing the barrier in the vein of pranavayu by samakapha. The portable mode of action of drug was because of its Tridoshahar effect, kapha vipak, and lagu and tikshna gun. The drug was given with honey, which itself has good kaphahar action as per classic. It is one of the best suggested vehicles that have yoga vidhi property, which does not interfere the drug property and just transport it. Conclusion. Increasing prevalence of bronchial asthma in children is a global issue of concern due to associated long-term compromise in quality of life. Symptomology of bronchial asthma in children closely resemble with tamak shwas, which is kapha vata pradhan disease involving pranavaha srotas, with some dushti of annavaha and udakvaha srotas. Ayurveda has constitute multi-dimensional approach for the treatment of bronchial asthma. The management of Shwas in Ayurveda should be compromised Snehan Svedan, Vaman Virechan, Dhupan, Nasya, Ushna, Vatanuloman, Vatakava Shamak, Am Pachak, Strotoshodhak, Kapha Nissarak, and Rasayan medication. Rest is the reference. Should I read it or no? Okay, thank you.
Doctor, one more poster presentation is pending, right, doctor?
Yes, sir.
Just a moment, doctor, I'll share for you.
Yes.
And please start the session, doctor.
My topic for poster presentation is cerebral palsy. First, the definition. Cerebral palsy is defined as non-progressive static disorder of the central nervous system due to injury to immature brain, causing disorders of movement and posture. Then, the early sign of cerebral palsy, that is main sign, we show in early stage. First is increase or decrease muscle tone. Second, arching of the back. Then, poor head control. Next is inability to sit up by 8 men. Generally, child sit up to by 6 months. Then next is maybe epilepsy or seizure attack. Then random or uncontrolled body movement, eating and swallowing difficulties, and sleeping problems. There are 4 types of cerebral palsy. First is spastic, dyskinetic, ataxia, and next is mixed type. Then spastic type, it is most common type of cerebral palsy. 80% of the people having spastic type. In spastic CP, they have increased the muscle tone, mainly spasm all over the body. Second is dyskinetic. In dyskinetic type, the problems are controlling the movement of their hand, arm, feet, leg, and making it difficult to sit and stand. Mostly fine motor movement are uncontrollable. Third is ataxic. Ataxic type have problem with balance and coordination. They might be unsteady when they walk or having hard time during quick movement or movement that need to be lot of control, like first writing, eating, cycling. And next is mixed type that have all first 3 of type, that is spasm, dyskinesia, ataxia. Last is goals of management of CP. There is no specific management of in cerebral palsy. We have to do all our achievement. First is the ultimate and long-term goal of the treatment of CP. That is gaining independence in daily regular activities, that is school activities, social life, working life, that is office life. Then next is short-term goals of the treatment of CP. We have to increase this, we have to work on this quality, that is improve mobility, prevent deformity, any deformity like arching of the back, spasm, educate the parents, then teaching daily life skill. Next is provide community and social support, like we give patient give speech therapy, occupational therapy, unless if they have epilepsy or seizure, then we will start anticonvulsant oral or IV. And this next is in Ayurveda we can start the Panchkarma, Snehan, Svedan, Nasya Karma, Shirodhara. Okay, thank you, sir.
Thank you, doctor. Thank you for the wonderful presentation.
Thank you, sir.
Next, I invite Dr. Priyanka Bangre for the paper presentation. Dr. Priyanka Bangre, are you there?
Yes.
Okay, doctor. Can you please share the screen, doctor?
Just a minute, sir.
Okay, doctor.
Sir, can you share?
Sure, doctor. Sure, doctor. I'll share for you. Just a moment, doctor. And doctor, please start the session.
Good evening, everyone. So today's my topic is the research-based role of yoga in neurological disorders. I am Dr. Priyanka Bangre, Assistant Professor in Vardha. Next. Next. So the brain can change throughout our lives. Fortunately, the symptom caused by stroke, multiple sclerosis, and Parkinson's disease are the conditions can be affected by yoga therapy techniques. Yoga practice help to change people's relationship to themselves and the condition which they live. Living with lifelong neurological conditions in a challenge both physically and mentally. Yoga is one of the widely used mind-body medicine, supportive and potentially long therapy for neurological disorders. Next. So the aim of this study is to collect the research-based reviews of role of yoga in neurological disorders. Next. So utilization of yoga in neurological disorders, numerous studies have been performed to validate the use of yoga as a complementary alternative treatment modality in various neurological disorders. Next. This is for epilepsy that according to 2009 WHO epilepsy face sheet, over 50 million worldwide documented case of epilepsy are there, and a study is published that the patients with drug-resistant epilepsy adhere to a twice daily yoga meditation protocol, and they in that study it is reported that all patients get benefited. And next, sir. Next, sir. So in stroke prevention and rehabilitation also, there was a study for 12 weeks of Kundalini yoga practice, and this study also showed that for the prevention of stroke and rehabilitation in cases, yoga is more beneficial. Next, sir. For the multiple sclerosis, there was a randomized RCT was done, and the yoga was compared to sport climbing for its therapeutic value in treating multiple sclerosis. And in this also, they reported that yoga was beneficial for the multiple sclerosis also. Next, sir. In Alzheimer's disease, there was a study that, but there was very limited study have been conducted with the Alzheimer's patients relating to effect of yoga with preventing cognitive and memory decline, and further research is needed in this area. Next, sir. Here was a study was done for the Alzheimer's patients, 10-week chair yoga intervention on cognition, balance, activities of daily living, and which suggests that the yoga may have more benefit early in the progression of the AD, but rather than later stages. Next, sir. Again, peripheral nervous system disorders. Yoga has also shown benefit in peripheral nervous system disorders. In a study that 40 days of yoga session and kept 20 other patients in a control group, and results exhibited improvement among the test group in right and left hand median nerve conduction velocities. Next, sir. Here are some yoga practices which are overall beneficial for neurological disorders. That is calming and rejuvenating yoga exercise into poses for that is Anulom Vilom Pranayam. Next. Then Sarvangasana, it is also beneficial. It is also known as mother of all poses, and it is beneficial in such cases. Next, sir. Then forward bending pose, it is also known as Padahastasana. This inverted posture is essential in stretching the hips, and it is also useful and beneficial for headache and all other neurological disorders. Next. Matsyasana, it is known as destroyer of all diseases. The fish pose promotes deep breathing by stretching and strengthening the lung muscles. It opens up blocked channels within the ribs, chest, and throat, and thus it enhances circulation and promote oral immunity. Next. Halasana, it is also useful in calming the nervous system and boosting the immune system of the body. And also it normalizes blood pressure and improves one's mental and physical state. Next. Shavasana. This yogasana is a must for insomnia, marking the end of the yoga session. Not only does the Karpas pose enhance concentration, relieve stress and tension, but also manages neurological problems. Next. So it is overall that how yoga helps in neurological disorders. Yoga increases gray matter density, then it increases the force in the brain. Next. Yoga stimulates the vagus nerve and decreases seizures frequency by 28 to 38% by modulating the brain waves, limbic system, and autonomic nervous system. Yoga is also attributed to the reduction in the level of stress as evidenced by changes level of blood locate, the urinary vanillin acid. Next, sir. So here is a discussion part that the goal of this review paper was to evaluate the credibility of yoga as a complementary treatment and management modality in different neurological disorders. Although this review provided some insight into the benefit of yoga in the various neurological disorders, most of the studies reviewed were only in the initial stages of understanding the clinical benefits of the yoga. Next. So conclusion is augmenting yoga to help people with neurological disorders presents an inexpensive, non-invasive, enjoyable and potentially cross-cultural supplementation to neurological disorders, control and quality of the life improvement. Based on the available literature, it could be concluded that yoga might be considered as an effective adjuvant for the patient with various neurological disorders. Next. These are the references. Thank you.
Thank you, Doctor.
Thank you, Doctor. Thank you for your enthusiastic and clear presentation. Your efforts and cooperation are truly appreciated. So,
thank you.
Thank you, Doctor. So next I invite Dr. Pooja for the poster presentation. Sorry. I would like to invite Dr. Pooja for the next presentation.
Dr. Pooja, are you there? Hello, Dr. Pooja, are you there? Next, I invite Dr. Sonudai Madhavrao Shinde for the paper presentation. Dr. Sonudai Madhavrao Shinde, are you there? Dr. Sonudai Madhavrao Shinde, are you there? And next, I invite Dr. Rajashree Ramakant Jahagadar for the paper presentation.
Hello.
Hello, Doctor.
Yeah, can you share my screen, PPTs?
Okay, Doctor, just a second. Doctor, you have submitted on a recording video, Doctor.
Yeah, it's a recording also and PPTs also. Otherwise, I'll try to share my PPT. Just a minute. Yes. Am I audible?
Yes, Doctor, audible.
Yeah. So today my topic for the paper presentation is efficacy of a Virejinottar Lekhanavasti with Udvartanam in Staulya with special reference to obesity. Myself, Dr. Rajashree Jhagirdar. Name of my guide is Manjusha More ma'am and Ambadas Kulkarni sir. Sri Saptashungi Ayurved Mahavidyalaya and Hospital, Nasik. So introduction is Staulya is a burning issue in the world and people following wrong lifestyle. So prevalence of the obesity is 14% and it is expected to increase 24% till 2035. So a pilot study was done for the 5 patients of the Staulya with special reference to the obesity at the IPD of the Panchkarma and where the BMI and hip waist ratio was assessed along with the Staulya symptoms of the Ayurveda, from the Ayurveda scriptures. So obstructive Staulya is the most common and serious issue, and if we don't teach people about the wrong lifestyle, sedentary habits, wrong eating habits, all those things, then it will increase more in future. So and the symptoms which are see like every Staulya patient shows the high BMI and raised hip waist ratio. That's why it is used with a special reference. Apatarpanam is the treatment which is achieved through the Samshodhanam. And in this study, Virejnam, Basti, and Udvartanam, these are the treatments which were chosen and assessed through BMI and hip waist ratio, and along with Anga Chalatvam, Kshudra Shwasa, Gatra Sadha, and Atikshuddha were assessed. So Staulya Nidana are, we all know, Manasika, Aharatmaka and Viharatmaka, and it could be Bija dosha also. But Manasika, Aharatmaka and Viharatmaka will give a Kafaruddhi, which will cause Jataragni Vaigunya, Ama, then obstruction in a Medavaha and Medas, and then Medadhatvagni Mandya, then Staulya. And it will show in the form of a Chala speaker, Chala Udara, Ayatha Upachaya, and Utsaha Hani. So material methods, the BMI and hip waist ratio was measured for the patients, and Anga Chalatva, Shudra Shwasa, Gatra Sada, and Atik Shuddha were assessed. Samprapti Ghataka are dosha, mainly Kledaka Kapha, Pachak Pitta, Saman, and Vanvayu. Dushya are Rasa and Meda. Agni is Jatharagni and Dhatwagni. Srotas is Medova Srotasa. And Srotadushti is like mostly Sangha and Ama. Then Adhisthana is whole body. Udbhavasthana is Amashaya. Rogamarga Bahya. Ama is, it could be Jatharagni Vaigunya Janita or Dhatwagni Mande Janita. And Vyaktisthana is a Sarvanga, especially Spik, Udara, Sthana, and Gala. When patients were chosen for the pilot study, the age range was 20 to 60 years. Patient having clinical signs and symptoms of Asthaulya, and BMI was in between 25 to 39.99 kg per meter square. Exclusion criteria was below the age of 20 and above the age of 60. Patient with a hypothyroidism on a long-term steroid therapy, diabetes, malignant hypertension, malignancy, hypertension, and then patients with renal, hepatic, and cardiac involvement were excluded, and BMI more than 40 gram per meter square and 40 kg per meter square and less than 25 kg per meter square were excluded. So during the treatment, for Dipan Pachana, Gandharvasadi Kashayam, Ashtachurnam, and Agnitundi were used for 3 days. For the Sneha Pana, Varnadi Gritam was used. For a Bahya Sneha, Tilatailam was used. And for Vireshnam, Ichabhedi tablets were used. Basti was given Yoga Basti, Matra Basti with the Tilatailam, and Kashaya Basti, Lekhana Basti was chosen from Charak Samhita. And Udvartanam further followed by Udvartanam with the Kola Kulathadi Churnam. So for the Lekhana Basti, Madhu 30 ml, Yavakshara 3 gram, Tilataila 60 ml, and Gomutra 200 ml was used, and Kashayam of a Haridra, Triphala, Daru Haridra, Musta, and Tagara was used. So total Kashaya use was 690 ml. So BMI before patient was like 36, and after like one patient 36, and then later it was 32.7. For another patient it was 34.51, and later it was 32.33, and waist hip ratio also reduced. So significant reduction was seen in every patient. However, the BMI, some like few patients could not go below 30, but maybe further management of the medicines and lifestyle changes will definitely give that result. Anga Chalatva, Shudra Shwasa, Gatra Sada, and Atik Shuddha, these symptoms also were seen that they were also, the score was reduced after the treatments. So discussion is Vireshnam done with the Ichha Bedi will help to reduce the Kapha dosha along with Pitta and Vata. Vasti helps to reduce Vata, and also Kafahara Vasti with the Gomutra and Yavakshara acts as a Kapha Medohar and will help in increasing the Datvagni, and also helps in a Sroto Shodhana. Udvartanam, due to Ushna Tikshna Guna of a Dravya and forceful massage on a Romakupa, the virya of the drug enters into the body, causing opening of a Mukha of the cirrus and causes the Paka of a Kapha and Meda. Svedana after the Udvartanam will further give the Paka, and then Stampa, Gaurava, and Shitagna action will be achieved. The conclusion is, as per data presented, the protocol helps to reduce the weight to some extent and improve the quality of life, so that further management can be done with the Medokapahara medicines along with diet, exercise, and lifestyle. Thank you.
Thank you, doctor. Thank you for this excellent presentation. And next, I would like to invite Dr. Priyanka Bangre.
Dr. Priyanka, are you there?
So next, I invite Dr. Kajal Dubey. I invite Dr. Kajal Dubey.
Hello, good evening.
Good evening, doctor.
Hello, good evening, everyone. Myself, Kajal Dubey. Hello.
You are audible, doctor. Good evening.
Myself, Dr. Kajal Dubey, MD Scholar, Department of Chikitsa. I am from Late Kedari Redikar Ayurved Mahavidyalaya, Gadinglach, Kolhapur. My guide is Dr. Viraj Shukla, sir. He is HOD of Chikitsa Department, Late Kedari Redikar. Excuse me, hello. Thank you. Late Kedari Redikar Ayurved Mahavidyalaya. So I'm presenting a poster presentation on topic effect of exercise in diabetes mellitus. So, hello.
Doctor, you are audible. Please continue.
Uh, so we all know that exercise is effective in diabetes, but how? Like when we are in UG, we used to laugh or we are sometimes confused. Like once our professor said कि प्रमेय में मीलों तक चलवाना होता है, कुआं खुदवाना होता है. तो हमारा ये क्वेश्चन होता था कि अगर किसी को प्रमेय हुआ तो उनको मेडिसिन मत दो, पहले उनसे कुआं खुदवाओ, उनको मीलों तक चलाओ. So we used to laugh on it, but it has significant effect on diabetes. So what happened during exercise? So during first 5 minutes, glycogen in the muscle break down in anaerobically, and then it is used in as a fuel to muscles, right? When this physical activity continues, the muscle oxygen becomes available. So aerobic activity or aerobic breakdown of carbohydrates, fats, protein occurs. After 5 to 10 minutes, what happens? Muscle glycogen breakdown decreases and glucose in the blood circulation levels are also less. So hepatic glycogenolysis occurs. So what happens? The glycogen broken down into in the liver to glucose. And when we continue this exercises for 20 minutes or more, the muscle glycogen stores are depleted. Then counter-regulatory hormones like glucagon, cortisol, epinephrine. These hormones stimulate lipolysis, resulting in triglyceride breakdown into free fatty acids, glycerols, and it fuels as muscle, fuel in the muscle. So lipolysis occurs, gluconeogenesis occurs. This hormone does what? It stimulates gluconeogenesis and suppresses insulin when blood glucose levels are less. So maintaining hypoglycemic levels occurs. So which type of exercise we should do? There are 3 types of exercises which we can do in diabetes. Like first is strengthening exercises. Like strengthening exercise uses large group of muscles and is static type of. So we have example like newdom, wrestling, weightlifting, krida games, वगैरह, कृषि, farming, and Kanedu kupam, like digging wells. Then second is aerobic exercises. Aerobic exercises it is when exercises uses oxygen and strength, large group of muscle and which use strength, oxygen as well. Like example, parikraman, like walking, brisk walking, swimming, cycling, etc. Third type is flexibility or stretching exercises like yoga, Naukasan, Dhanurasan, Bhujangasan, Ardhamastendrasan, Halasan, Vajrasan. These stretching exercises affect affect some abdominal wall and put pressure on abdominal wall. So what it does, it stimulates pancreatic secretion. It improves digestion, effective absorption, and slims down fat deposition, releases stress and fatigue, improves blood circulation. Effects of exercises on diabetes, it benefits as improvement in insulin sensitivity, improvement in dyslipidemia, improvement in glucose uptake mechanism, improvement in aerobic capacity, increased fibrinolysis, reduction in BP, and it maintains good glycemic control. Also, before exercising, we should check BP, even sugar levels also. Because exercises exercises causes hypoglycemia. So if patient is already if patient status is already hypoglycemic or had symptoms of hypoglycemia, and we do exercises, it may cause side effects or may cause more symptoms like decay or reduces our glucose levels. So in this condition, we should check vitals of patient, and we should have slight snacks in between the exercises. We should hydrate in between the exercises. So like that, exercises affect in diabetes mellitus. Thank you.
Thank you,
Thank you,
doctor.
doctor.
So next I invite Dr. Komal Vayal for the paper presentation.
Am I audible, ma'am?
Yes, doctor, you are audible.
Good evening, ma'am. Good evening, sir. Good evening, everyone.
Good evening, doctor. Please start.
My name is Dr. Komal Vilas Vayal. I'm from SVNHT Ayurved Mahavidyalay, Gauri. And today's my topic is investigations in obs and gynae. So we'll start from puberty. Puberty is a transitional period linking childhood to adulthood and involves physical, biological, and psychosexual changes. There is a precocious puberty and delayed puberty. Precocious puberty usually occurs before the age of 8 in girls and before age of 9 in boys. Delayed puberty is defined as no secondary sexual maturation or any sign of puberty by the age of 13 years in girls and 14 years in boys. In precocious puberty and delayed puberty, investigations are as radiography of pituitary fossa, CT MRI, ultrasound for ovarian tumor, thyroid function test, hormonal profile FSH, LH, estrogen, thyroid, etc. Then in polycystic ovarian syndrome, investigate hormonal is a hormonal disorder causing enlarged ovaries with small cysts on outer edges. Symptoms include menstrual irregularity, excess hair growth, acne, and obesity. In typical case, ultrasound alone is adequate to confirm the diagnosis. In other cases, low FSH or LH ratio, raised testosterone, adenosine will be observed. Hirsutism, unwanted male pattern hair growth on woman's face, chest, and back. Hirsutism can result from excess male hormone called androgens. Investigations include total testosterone measures the ovarian and adrenal activity, 17 OHP, DHEAS, gynecomastia. Gynecomastia is benign enlargement of the male breast caused by proliferation of glandular breast tissue. Baseline investigations includes serum testosterone, serum estradiol, LH and FSH, prolactin, SHBG, liver function test. Now, infertility. Infertility is inability to conceive after 12 months of unprotected intercourse. Infertility in male investigations are routine investigations include urine, blood examination, semen analysis. In selected cases, biochemical tests of creatine, phosphokinase, and reactive oxygen species are done as sperm function test, serum FSH, LH, testosterone, prolactin, and TSH, fructose content in seminal fluid, testicular biopsy, transrectal ultrasound. Infertility in female, investigations of female general HB, urine, RA, blood group, sugar, VDRL, HIV, SBHCG, urea create. Semen analysis report must be before further work is taken. Test for ovulation, tubal potency, FSH, LH, thyroid function, prolactin, screen for gonorrhea, chlamydia, microscopy of cervical mucus. Female examinations include weight, BMI, waist circumference for PCOS, skin, axial hirsutism, acne, male pattern, bleeding for PCS, breast glyctorrhea, cervix mucus fragility, uterine corpus, size shape, fibroids, uterine anomalies, corpus tenderness, PID, fixed retroflexion, EM, adenexa tenderness, PID. Diagnosis of pregnancy. Pregnancy test depends on detection of the antigen SCG present in maternal urine or serum with antibody, either polyclonal or monoclonal available commercially. SCG, human chronic gonadotropin hormone, preform using blood sample. UPT, urinary pregnancy test, it measures the amount of HCG in urine, obstetric USG. What tests are done in early pregnancy? The following lab test: complete blood sugar, blood type, urine analysis, urine culture, rubella, hepatitis, sexually transmitted infection, human immunodeficiency, tuberculosis, blood group, disorders in pregnancy, anemia, HB level below 10 gram per dl at any time during pregnancy considered as anemia. Anemia responsible for 20% maternal death. That is why investigations and proper management is important. peripheral blood simmer, hematological indices, stool examination, which should be done as a routine to detect helminthic infection, urine examination for presence of protein, sugar, and pulses. Bone marrow study. This is not done as a routine but indicated cases not responding therapy according to hematological typing to diagnose hypoplastic anemia, to diagnose Kala-Azar by detecting healthy bodies in iron deficiency anemia, pyrexia, temperature more than 8 degrees Celsius, once or 37.5 degrees Celsius on over 2 occasions 2 hours apart. Most common causes are URTI, UTI, septic abortion, dengue, malaria, typhoid. Investigations include hematology, HB platelets, TLC, DLC, blood grouping, urine analysis. Hyperemesis gravidum, nausea and vomiting are common in pregnancy, especially in first trimester. Some pregnant women experience excessive nausea and vomiting. This condition is known as hyperemesis gravidum. Investigations include urine analysis, CBC, liver function test, thyroid function test, ultrasound scan, ophthalmic investigations for recurrent abortion, preconceptional stage in blood group and RH typing, hemoglobin estimation, complete blood count, karyotyping, urine routine examination, microscopy and culture, glucose test, tolerance test, liver, renal and thyroid function test, torch, antiphospholipid antibodies. Then during pregnancy, routine antenatal test, torch, glucose tolerance, ultrasound, etc. Leukorrhea, flow of a whitish yellow or a greenish discharge from the vagina of female that may be normal or may be sign of infection. Such discharges may originate from the vagina, ovaries, fallopian tubes, or most common cervix. Investigations include wet semen, gram stain, blood culture, pap smear biopsy are suggested to diagnose the condition. Menorrhagia, excessive menstrual blood loss, which interferes the human's physical, emotional, social, and maternal quality of life, and which can occur alone or in combination with other symptoms, causes dysfunction, uterine bleeding, UCD, fibroids, endometriosis, adenomyosis, pelvic infection, etc. Investigations include FBC, ferritin anemia, TFT, coagulation, TBS, endometrial biopsy, hysteroscopy, etc. Thank you, ma'am.
Thank you, doctor. Thank you for the wonderful presentation.
Yes, 2 minutes.
Mute yourself. And next, I would like to invite Dr. Dyamana Gowda H. Patil.
Good evening, madam.
Good evening, doctor.
Sir, can you share this slide?
Sure, doctor. Just a moment.
Sir.
Please start the session, doctor.
Myself, Dr. Dyamana Patil, PG Scholar, Department of Shalatantra. Today I am going to discuss about Ashmari. Coming to the definition of Ashmari, Ashmana Rati Dadati Iti Ashmari means the formation of and presentation of substance like stone is known as Ashmari. Coming to the Nidana, Tatra Asamshodhana Silasya Apatikaranam Prakupitaha Shleshmaha Mutraha Samprakoto Anupravishyaha Basti Ashmari Janayiti. Coming to the types, there are 4 types: Kafaja, Vataja, Pittaja, and Shukraja. Coming to the Pura Rupa means Jwara, Basti Pidaha, Arochaka, Mutrakrichchhra, Basti Shiro Vedana, Mushka Vedana, Shofa Vedana, Avasado, Basti Gandhitvam, Janayiti. These are the Pura Rupa of Ashmari. Coming to the Rupa of Ashmari, Nabi Basti Sevani, Mahaneshu, Anyatam, Asmin, Mehate Vedana, Mutradhara Sangaha, Sir Rudira Mutrata, Mutra Vikiranam, Gomedaka Prakashamam, Attavilam, Sasikatam Visrajita, Davanam, Langanam, Plavanam, Pushtayano, Ushna, Advagamanai, Jasya Vedana Bhavanti. These are the Rupa of the Ashmari. Coming to the Dosha wise, Kafaja. Next slide, sir. Coming to the Kafaja Ashmari, Tra Pratigata Dalate, Bidyate, Nistudyate, Ivacha, Basti Guruhu, Shitascha Bhavanti, Shwetaha Snigda Mahati, Kukutanda Pratikasha, Maduka Pushpa Varna Va Bhavati. These are the Kafaja Lakshana. Next, coming to the Pittaja. Pittaja Chushate Dahyate Pachate Eva Basti Rushna, Vatascha Bhavati, Sarakta, Pita Vabasa, Krishna Ballataka, Asti Pratimaha, Madhu Varnaha, va bhavati. These are the pittaja lakshana. Kafaja ashmari lakshana means the tivra vedana bhavati, pidyamano dantan khadati, nabhi pidyati, medram pramudanati, payum sprushati, nishardate, vidahiti, वातमूत्र पुरुषिणं कृच्छ्रेण चास्य मेहते नि सरन्ति शाव परुष विषम खर कदम्ब पुष्प वत्कंटका चिता भवति ताम वातकिमितः. Coming to the Shupraja Lakshana, Tesham eva alpa bastikahya tva danu pachita mamsatvach bastaha sukha grahanaharanaha. Next slide, sir. Coming to the general treatment, Gutai Kshara Kashayascha Kshira Sa Uttaravastibhi, Yadi Na Upashama Gachas Chedastata Uttaravidhi. Coming to the special treatments, Aushadas Tarunaha Sadhyaha Pravruddha Chedanam Arhati Tasya Purveshu Rupeshu Sneham Adikarmaha Ishyate Te Nasya Pachayam Yanti Vyadir Mulaha Shoshetaha. Next one, sir. Surgical removal of stones. Enlargement requires surgeries. Minimal snehana and swedana should be given. Minimal shodhana should be given, followed by the eating of lagu ahara. Then patient made to sit on the level of board or table height at the knee joint, upper part of the body on the lap of the attendant, and with the waist resting on the cushion. Then snehana in the nabi is again given. Then pressed the vama parshva of the abdomen with a closed fist. This helps to the stone move inferiorly to the reach the surgeon. The left hand of the surgeon will now try to feel the granthi, and then with a poking movement pull down. In female, the stone is obtained with a lateral incision due to the presence of uterus. After that, treat the patient as Sadhyorana case. Next slide, sir. Coming to the post-operative, the patient is made to sit in the droni full of warm water for Svedana purpose. If the blood is present inside the bladder, a kashaya of Chiri Ruksha should be given into the bladder. Next slide, sir. Next slide. Ashmari, when broken into the smaller pieces by Vata, is called as Sharkara. Gratai Kshare Kashayascha Kshirahe Sa Uttarastibihi Yadi Na Upasham Gachai Chedastata Uttaraha Vidihi. Means the Gruta Yoga should be given. Next Kshara Yoga Kashaya as per the Dosha Prakopa should be given. After that, Uttarabasti should be given. Next treatment, sir. Next slide, sir. If the treatment is not given to the patient on time, there is a possibility of mrityu. Hence, one has to resort the surgical extraction in the as the best outcome for the patient to the being dangerous. Next slide, sir. Coming to the preoperative, post-operative and post-operative aspects. Coming to the pre-operative, in pre-operative, snehana svedana should be given. Next, advised lagu ahara means take to light food. Sambara sangra should be Sambara sangra as told in Agroparani Adhyaya has to be arranged. Next, Bali Pradhana Mangala Pata Swasti Vachana should be done. Next, sir. Next slide. Coming to the Pradhana Karma, patient to be laid in supine position with a rising waist on the support of both the hands in the lap of the Paricharaka, sitting on the both the sides. Next, flexed knees and elbows tied with a rope. Then well massaged left umbilical region should be rubbed and pressed with a closed fist till the stone falls down. Now index finger and middle finger of well lubricated with a nail skirt should be introduced into the anus. Now the ashmari is brought between the anus and genital with a huge effort. If one catches the shell and if Vivritakshya Vichetana Hastavalamba Shirshascha Nirvikara Mrutopayam is not seen or not seen, should be proceed. Now in the Vama Parshva means left side of the Sivani, leaving with a space of 1 Yavadana incision should be made in the size of ashmari or in Dakshina Pradesha. Care should be taken as the stone should not be broken, because if some amount of sit inside may lead to the further development of the stone. So it is removed with the aharana yantra. In women, incision should be superficial, otherwise it will lead to the wound discharging urine. Next slide, sir. Next slide, sir. Already done, sir. Next slide. In case male also, if more than one wound over the bladder is difficult to manage, and one point due to the calculi will manage in the post-operative treatment. Coming to the Paschatkarma, sir. Next. Now Ushtadroni Sveda, in Paschatkarma, Ushtadroni Sveda is given by making him sit in the droni. By doing this, blood will not coagulate at one point. If basti become full with the blood, Uttara basti should be given with the Kshirin Ruksha Kashayas. And for Mutra Marga Shodhana, Guda Mishrita Dravyas are given. After that, Madhu and Gruta applied over the Rona. In different treatment, different washes are told. 1 week, if urine is not coming, Agni Karma over the Rona should be done, or with Uttara Basti, Madhura and Kashaya Varga Kwata or with a Snehana or Kashaya Basti should be done. Next slide, sir. And in Shukrashmari is struck in Mutra Morga, it can be removed by body Shantra. And advice for 1 year, he should not do Stri Seva, riding horse and climbing. Precautions. Some of the precautions should be take care of Sivani, Shukravaha, Muskar Sotas, Buddha, Mutra Praseka, Mutravaha, Yoni, and Basti. In case if tear of Shukravaha, it leads to the Napumsaka. If in Mushka Sotas, Dojabanga Klaibya, Basti Mukha Varuna will lead to the Mutra Srava. If Sivani and Yoni leads to the Vedana. Thank you, sir.
Thank you,
Thank you.
doctor.
Thank you, sir.
So next I invite Dr. Urmila Rajkumar Ramnani. I invite Dr. Urmila Rajkumar.
Dr. Urmila, are you there?
Next I invite Dr. Sonutai Madhavrao Shinde. And now I invite Dr. Charushila Ramesh.
Hello.
Hello, doctor.
Hello, Dr.
Dr.
Urmila.
Urmila.
Good evening, doctor.
Sir, can you please share my slide?
Sure, doctor.
Sir, can you please share my slides?
Sure, doctor. Just a moment, doctor. I will share for you. Just a moment, doctor.
Dr. Urmila Ramnani.
And Dr. Urmila, please start the session, doctor.
Okay, thank you, sir. My topic is Mudra therapy and its health benefits. Firstly, myself, Dr. Urmila Ramnani from SMT KC Ajmera Ayurved Mahavidyalaya Dhule, PG scholar Swasthavritta. My guide is Dr. Rajesh Shah Mangalal, HOD Swasthavritta Department, SMT KC Ajmera Ayurved. Am I audible?
Yes, Dr. Audible. Please continue, doctor.
Okay. Mudra therapy and its health benefits. Mudra means the gesture, seals, or mark. Mudra literally means that the expression of the internal feelings through the various body postures, including those of the fingers, palms, hands, and feet. So, can you please, please next slide. So, please, can you change the slide? Thank you. This is a crucial component of yoga as well as scientific understanding of spirituality and health. Yoga is a physical practice that promotes a healthy lifestyle for a people of all ages, and it has been recognized as an important element of today's culture. The entire body is involved in the mudras with the delicate motions of the hands and fingers. Particular energy channels and stimulated and significant connections are made within the neurological system. These hand positions or mudras pay advantages for one's emotional, mental, physical health. Mudras are performed in yoga conjunction with the pranayama, typically while seated in Padmasan, Sukhasan, Vajrasan pose or any comfortable position to stimulate the different regions of the body and mind as well as to influence the flow of prana throughout the body. So please next slide. Sir, can you please change the next slide? Yes, thank you. The conceptual aims and objectives of this study is the conceptual study of mudra therapy and to understand the health benefits of the mudra therapy. Many Ayurvedic samhitas and databases like PubMed, Dhara, Google Scholar were examined and studied for this study. Please, sir, next slide. I'll explain the science behind the mudra. Is the movement of energy from a higher level to the lower level. This law applies to the atomic and nuclear bonding, electricity, and magnetism. electrostatic and thermodynamics. The five components of Agni, Vayu, Akash, Prithvi, Jal makes the human body according to Ayurveda. In healthy state, these all components these all components are in balance in our body. When this any imbalance in these components may ultimately results from this. The individual heals when the certain mudras are done to correct any imbalance in the five elements. Five fingers of our hand represent these elements. Like thumb represents the fire, index finger air, middle finger space, ring finger earth, and little finger or pinky finger is indicated water. Rules to perform this mudra: all persons of any age, sex, religion, norm can perform this. Normal time to perform specific mudra is 15 to 20 minutes. One can stop this mudra practice when extra stress during the performance of mudras. Mudras can be performed while standing, sitting, walking, praying, studying, reading, TV, etc. The elemental mudra should be done with the both hands. Doing on the left side benefits the right portion and vice versa. For the elemental mudras, the basic principle is that the bringing together the tip of any finger with the thumb brings the equanimity. Pressing the finger with the thumb reduces the element, and touching the base of the finger increases the element of that finger. It can be done with any undergoing treatment also. Mudra therapy. So can you please change the slide? So next slide, please. I explained this previously that the mudras are the hand gestures, yoga exercise that aim to bring back the elemental balance, guiding the flow of energy within the body. Depending upon the elements to be balanced, specific yoga mudras are practiced by manipulating the fingers. Depending upon the elements are imbalanced. To increase the example, to increase the water element in the body, Varun mudra is practiced. Similarly, to reduce the air element in the body, Vayu mudra is. Some mudras are described below. Sir, please, can you change the next slide? First is the Gyan mudra. Gyan mudra is the powerful mudra practiced for thousands of the years by yogis that brings the peace, calm, and spiritual progress. Artistic depiction of great spiritual masters such as the Guru Nanak or goddess, we have seen that they were in a Gyan mudra positions. Procedure to do this: it connect the thumb and forefinger tip to tip connection is there. The other fingers are straight but relaxed. Pressure between the thumb and forefinger best mudra to sharpen your memory and heal your internal organs by helping the stress and depression and insomnia. This will sharpen your memory and enhance your inner spiritual qualities. This it brings in metabolic changes in our body, which increases the flow of blood to the brain, which causes the sharpen our memory and other stress, depression, or mind related problems were solved. Next, Akash Mudra. The Akash Mudra is the Akash words view term means the view or recognize. Mudra means the gesture or seal. It is also known as the Shunya Mudra, which means the gesture of the patient. Procedure: first, sit in any comfortable position. By straightening your head, neck, back, straight line, proceed to deep the breathing, increase your awareness required for the practices. Next, place your back, the palm or knees. Gradually fold the minded finger, middle finger, and touch it firmly against the thumb. Now, the maintaining the contact of the middle finger and thumb, extend the rest of your fingers as much as possible. It benefits or relieves the condition of migraine. It reduces sinusitis pain. It induces the centers of concerned nerve cells in the nervous system, therefore improves the functioning and ultimately affects the hearing ability of an individual. Practicing Akash Mudra stimulates the other side of those pressure points further. The interaction of the calcium, vitamin D, PTH regulates and the body calcium level. Therefore, it cures the calcium deficiency. So next, the Sanskrit word Prithvi. So please next slide. Thank you. The Sanskrit words Prithvi refers to the earth and the Mudra refers to the gesture of an earth, considered as one of the elements within the body. And with the practice of the Prithvi Mudra, it helps to awaken the earth element. Procedure. Ring finger and thumb are used in this mudra. Sit in a comfortable position. Now place the hands with the palm facing upwards, the thighs or knees. Now slowly fold your ring finger and tap the tip of the ring finger on the anamika finger to the tip of the thumb with a little pressure, and try to keep the rest of the three fingers extended straight as much as possible. Benefit: it helps to prana flow the better through our spine and other parts of the body. This flows the prana, encourages energy distribution in all parts of our body. Thus, the regulate the practice of this mudra keep us energetic and prevents finger fatigue, weakness, and laziness. It heals the body tissue and boosts the growth of the tissue. Prithvi Mudra heals the cuts, wounds, and cracks skin and fracture bones, and the density of bone is increased. So please next move. Apanvayu Mudra. Apanvayu Mudra is a therapeutic mudra, mainly helps in healing the heart-related disease. Firstly, so please next. Thank you. Firstly, join the tip of the middle finger and ring finger with the tip of the thumb. Secondly, bend the index finger towards the thumb and touch the base of the thumb with the tip of the index finger. Leave the little finger extended as much as possible. Do the same arrangement in both of the hands stabilizly. Now, without disturbing the finger arrangement, place both hands on your upper thighs. It cures the shrinking of heart arteries. It beneficial in reducing the effect of the heart attacks. It reduces the elemental element in the body, which improves the digestion in the body. It improves the lung function, thus the helps to cure the such problem. Surya Mudra. Surya means the sun, and here so please next slide. Sir, can you please? Thank you. Surya means the sun, and here Mudra means the gesture. Surya Mudra basically finger arrangement that represent the energy in our body gained through the sunlight. Sit in a comfortable position, yogasana mat, and not directly on the floor. Now arrange the fingers in the same way. Bend the ring fingers on your both hands, such as way that tips of the finger touch the base of your thumb, and thumb pressing the top of the second phalanx. As shown in the image, arrange another hand finger in the same manner. After aligning the body, hand comfortably hold your hands over the knee. While pressing down the ring fingers, make sure that the other fingers are lightly stretched. Benefits of it helps in maintaining the metabolism of the body. As Surya Mudra increases the body temperature, it relieves from the problem caused by the cold weather like dry skin, sore throat, and painful joints or flu. This mudra works for removing the extra cholesterol accumulated in the body, blood vessels, and hence reduces the risk of heart attacks and indirectly helps in the curing the diabetes also. It tackles coldness of limbs. Surya Mudra helps in problems like a shivering, coldness or body. Please the next slide. Prana Mudra. Prana Mudra is the energy or L spirit of life. It's in all self. The Prana Mudra is a single of the most vital mudras of it. Helps to turn on the inactive energy in the body. The energies the body and awakens the all organs. This mudra links to the heart, soul of the person. Procedure to do this, it is done on the help of the both hands. Tips on ring plus little finger have to be joined by the lean of the thumb. All other fingers must be extended straight. Prana mudra straight alerts the energy in the body, making you fit conscious breathing by your hand mudra space. As shown in the you can see. Benefits of it: this mudra assists the eliminates the any kind of A, B, C, D, E, K vitamin deficiency. It improves and regulatory power of the mind. The mudra might be help in tackling unregulated habit, for example eating and sleeping disorders. It decreases the nervousness, thereby improving self-confidence. It fights against the chronic fatigue, general weakness. It helps to manage emotion, for example anger, mental tension. envy, techniques, pride, restlessness, review, happiness, delight, enjoyment, wish, energy, and obsession. It also has the power to enhance your immune system. It treats eye irritation like. Next slide, please. Thank you. The hand and finger position of mudras or hand gestures make an important connection in the nervous system and stimulates the specific energy pathways. It also said that the mudra increases the energy and blood circulation to different parts of the brain to important nerve junctions and glands. Early yogis mapped out the hand areas and their associated reflex which relate to the different areas of the body and brain. Review that the mudra therapy can be control of stress, depression, anxiety, fear, promotion of mental health and happiness. Studies have shown that the mantras can have beneficial effect on the health and body as well as positive results in mental and physical levels. The yoga hand mudras was found to be effective in normalizing high blood pressure in a novel way. This mudra is helpful in emergency situations where medical help is not available immediately. It also can reduce the further medical deterioration of patient's clinical condition. Next slide, please, sir. The conclusion of this study is the various types of yoga mudra can be practiced at any time and from any location, including the bus, train, car, office, and home. Experts advise you doing the yoga mudras continuously for 24 minutes in order to achieve the optimal benefits. It also possible to perform it 5 minutes at time. You have to taste it, believe it. You stand to gain great deal to lose nothing. Therefore, the affirmation mudras applied strain to the neural pathways that make up the psychoneural circuit, assisting the balance of the five fundamental components and reducing the infection of the bronchi and cuff. Additionally, it relies the tension and redirects the internal energy, which modifies the vein, tendons, glands, and sensory organs to bring out the alteration. Thank you.
Thank you, doctor.
Thank you, sir.
Thank you
So
for the wonderful presentation.
next I invite Dr. Charushila Ramesh. I invite Dr. Charushila.
Okay, next I invite Dr. Rubal Vilas Raud for the paper presentation.
Hello everyone, good evening. Myself Dr. Rupal Vilas Raut, PG scholar from Yashwant Ayurvedic College, Kodoli, Kolhapur. My today's topic is conceptual study of Apang Marma with respect to its regional and applied anatomy. Swastasya swastharakshanam aturasya vikara prashamanam cha. Being an Ayurvedic student, we all know that Ayurveda aims to maintain hemostasis among the healthy person and cure the disease from diseased person. Numerous scientific concepts of Ayurveda need a detailed scrutiny to contribute their utility in the field of science, and Marma is one of them. Marmas are the points over the body that are the seats of life called prana, and prana means life force energy. The part of the body which on injury causes death is called marma. It is observed that the knowledge of marma was used for various purposes like warfare, self-defense, surgery, etc. since the Vedic period. Looking at the importance of this marma with regards to surgeries and other therapeutic procedures, this paper aims to study modern and ancient therapeutic guideline of Apang Marma to create better understanding of its anatomical description. Marma point is defined as anatomical site where the mansa, that is muscles, sira, that is vessels, snayu, that is tendons, ligaments and nerves, asthi, that is bone, and sandhi, that is joints, meets together. Any injury to this part may lead to severe pain, loss of sensation, loss of function, disability, and lastly death. If person injured in such vital spots die immediately, and if anyone survives by the treatment of a skillful physician, he is sure to suffer from our deformities. Acharya Charak explained that the marmas are such point where the sense of pain is felt more intensively compared to the other parts of the body. Classification of marma. Acharya Sushruta has elaborately mentioned 107 marmas along with their location, their dimension, predominant structures, and effect of injury in the body. Apang marma lies at the lower part of the tail end of each eyebrow and outer to the lateral canthus of each eye. Apang marma is one of the Vaikalakara marma present at the outer angle of eye and lateral side of orbital fossa, which controls the sense of sight. The predominant structure in Apang marma by Sushruta is a sira, while that by Vagbhata is a snayu. Anguli Praman of Apang marma is half anguli. Description of Apang marma in modern literature. According to the modern science, Apang marma is occupied by zygomatic and temporal vessels, optic, ciliary, ophthalmic, abducent, and frontal nerves, drainage to the superficial parotid lymph nodes, and sphenoid, maxillary, and zygomatic joints. All the recent authors have tried to correlate the structural entity of Apang marma with the structures lying on the lateral side of the eyeball. Ghanekar has mentioned that zygomatic or temporal vessels running near the outer corner or canthus of the eye and are the structural entity of Apang marma. P.V. Krishna Rao is of the view that optic, lacrimal, and abducent nerves are the anatomical structures corresponding to the Apanga marma. The endocrinal components in sera, middle meningeal artery and middle cerebral artery is present at the point of Apanga marma, where meninges of brain related to Apanga area with neuroconnective tissue components are present. Intra-orbital components: lateral rectal muscle, superior oblique muscle, inferior oblique muscle. The inferolateral part of the lacrimal gland is present at the point of Apang marma. Also, lacrimal vessels and orbital branch of middle meningeal artery, ophthalmic vessels, including its central retinal and other branches lying in the deeper levels, are present at this point. This point includes orbital fascia, lateral palpebral ligament, cheek ligament, bulbar fascia, lacrimal nerve, communicating lacrimal branch of zygomaticotemporal nerve, abducent nerve, ciliary ganglia, and its short ciliary nerves, oculomotor, and optic nerves were passing at this point. Hence, injury and trauma to this Apang marma leads to severe disabilities known by, according to Sushruta, injury to Apang marma leads to andhya, that is blindness, or drishti apaghata, that is visual impairment. Bhagavata has mentioned andhya as the injury effect of this marma. Injury at this point may result in maiming or deforming organs. Also, the facial deformity. Lacrimal artery at the lacrimal gland is the structure responsible for visual impairment. Vascular bleeding due to trauma at this site may lead to partial or complete loss of vision due to ocular pressure. The blockage of the arterial supply to the lacrimal gland or the hematoma affecting the lacrimal nerve may lead to degeneration of the lacrimal gland. Trauma on the middle meningeal artery, which also comes under the area of Apanga marma, causes extradural hematoma. Venous drainage of the eyeball causes papilla edema. Atrophy of the optic nerve may cause blindness. Middle cerebral artery is another structure that comes within the Apanga Marma area. Most of the part of the optic pathway is supplied by this artery. Stroke can occur due to middle cerebral artery rupture at this point. Traumatic optic neuropathy can cause diplopia, restriction of eye movements in all directions, and diminution of vision. Discussion. As per the regional anatomy, Apang Marma is laterally to each eye, that is lateral to orbital cavity and near the zygomatic process. Any injury over this point may lead to functional disturbance of vision. Conclusion. Apang Marma is one of the Urdhva Marma lying in the temporal region of the lateral aspect of the eye, below the tail end of the eyebrow. Sira is also the predominant structure of this marma given by Acharya Sushruta. Injury to this structure results in the blindness or visual impairment. Vagbhata has mentioned that as Snaya marma and blindness as the injury effect. The case report and clinical studies related to the area of Apang marma favors the opinions of ancient Acharya. Vision is considered as the most important sense of the body and likely to be affected by trauma on Apangamarma. So it is pertinent to mention that the areas of Apangamarmas are advised to protect from any kind of injury from any objects or during the surgery. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next, I invite Dr. Mohankumari for the paper presentation. Dr. Mohankumari, are you there?
Yes, sir.
Okay, doctor. Good evening, doctor. And please start the session, doctor. Hello, doctor. Can you hear me? Hello, Dr. Mohankumari. Can you please unmute, doctor? We can't hear your voice, doctor.
Hello, sir. Good evening, sir.
Good evening, doctor. Please start the session.
Sir, is the screen visible, sir?
I will share for you, doctor. The screen is visible. Please start the session, doctor.
Okay, sir. Thank you. Good evening, everyone. Myself, Dr. Mohana Kumari, second year PG scholar, Department of Shalakya Tantra from GMC Bengaluru. And topic of my presentation is traumatic optic neuropathy under the guidance of Dr. S.M. Pasha, sir. Optic nerve atrophy refers to the death of the retinal ganglion cell axons that comprise optic nerve, which can adversely affect the central vision, peripheral vision, and color vision. This is a case report of 45-year-old man who approached our OPD with signs and symptoms of traumatic optic atrophy in his left eye since 1 year. The plan of treatment was with Brumhana and Rasana line of treatment, which is mentioned in the classics. There Akshitarpana, Nasya, Chakshusha Vasti, Taila Dhara, and some Shaman Aushadhis. Unfortunately, there is no treatment to reverse optic atrophy in conventional medicine. However, limiting further optic nerve damage is the goal. Here, the Ayurvedic treatments are adopted to restore the vision loss occurred in traumatic optic atrophy. Next slide, sir. The case report, male patient age 45 years consulted OPD complaining of blurring of vision in his left eye since 1 year. And a patient had met with a road traffic accident, got hit on his forehead, that is closed head trauma, and he was unconscious and hospitalized for 15 days. After discharge, he was advised to take rest for 3 months. During this rest period, he noticed blurring of vision in his left eye. Gradually, it increased and he was unable to do his daily activities. So he consulted an ophthalmologist and he was diagnosed the condition as traumatic optic atrophy. And he underwent treatment, but there was no marked improvement. Next slide, sir. And past history of motorbike accident 1 year back, and family history was nothing significant. Personal history, bowl once in a day, appetite is good, micturition 4 to 5 times per day, and sleep was sound sleep. Next slide, sir. Ashtithana Pariksha, only Druk was Vikruta, and vitals, pulse rate was 76 per minute, respiratory, temperature, everything was normal. And all the systemic examinations revealed no abnormalities. Coming to ophthalmic examinations, visual acuity. The distant vision in his right eye was 6/9. With the pinhole, the improvement was seen. And near vision was in 6. In his left eye, distant vision was perception of light negative and no improvement with pinhole. Please next slide, sir. On slit lamp examination, right eye, eyebrows, eyelashes, eyelid, conjunctiva sclera, cornea, and anterior chamber were normal, and pupil round, regular, and reactive to light. Lens normal. And coming to left eye, pupil was round, regular, and mid dilated, and it was sluggishly reactive to light. RAPD was positive, and in both eye, IOP was normal. On examination of fundus, media was clear in both eyes and vessels. In right eye, it was normal. In left eye, vessels were thin. In left eye, optic disc was pale and disc margins were blurred. Macula was normal. Foveal requires normal in both eyes. CDR was normal in both eyes. Next slide, please, sir. On investigations, a high-resolution CT scan of the brain, an MRI of the orbit may reveal the focal edema of the optic nerve or optic nerve sheath. Differential diagnosis: axial myopia, post-ischemic optic neuropathy, optic neuritis, optic nerve avulsion, choroidal rupture, Foster-Kennedy syndrome. Next slide, sir. This is the structure of diagnosis of traumatic optic neuropathy. Next slide, sir. So coming to the treatment plan, for the first 3 days, Amapachana with Chitrakadivati, 1 TAD was given. For next 7 days, Nasya with Panchendriya Vardhana Taila, 12 drops in each nostrils. Then Tarpana with Jivantyadi Gruta for the next 5 days. And Annalepa or ice for 7 days with Balamula Kvata. Then Shirodhara with Kshirabala Taila for next 7 days. And internal medicines were Vidaryadi Kashaya, 15 ml BD with 60 ml lukewarm water before food. Balaristam and Ashwagandharistam, 25 ml after food. At afternoon and night. And Saptamritaloha, 2 tablets at night with honey and ghee after food. And Kshirabala, soft gel capsule 1 BD with Kashaya. Triphala Gruta, 1 tablespoon at night. So after a follow, only the improvement was seen in visual acuity. On distant vision, right eye, it shows 6/6. Pinhole also same 6/6. And in left eye, hand movement was positive at 2 meters. So the total treatment duration was 38 days. Subject showed improvement both subjectively and objectively. So the The treatment options are systemic steroids of varying doses, duration, and mode of administration, surgical compression of the optic canal, a combination of steroids and surgery, and conservative management. The cellular therapy is one of the new effective methods of the therapy. Latest methods in the treatment. Stem cells are immature cells, the uniqueness of which is that they can become cells of various organs and have a very high regenerative potential. These are the references. Thank you.
Thank you, Doctor, for the insightful presentation.
Thank you, sir.
Thank you, Doctor. So next we have the most awaited presentation. For that, I invite Dr. Sneha Rajendra Vidate.
Hello, Dr. Sneha. Good evening, Doctor.
Yes, sir. Am I audible?
Yes, Doctor, you're audible.
Please make me co-host so that I can share my slide.
Okay, Doctor.
Sir, is it slide visible?
Yes, Doctor, your screen is visible, Doctor. Please start the session.
Okay, shall I start?
Yes, Doctor, please.
Yes. Good evening to all. My topic is assessment of comparative viability of haritaki with and without sharkara as an anupan in healthy volunteer. Myself, Dr. Sneha Vidate, Assistant Professor from the Dravyaguna Department, Mahatma Gandhi Ayurved College, Hospital and Research Center, Salod, Hirapur, Bardhan. Introduction. Terminale chebula, a member of Combretaceae family, its fruit rind is used in medicine in Ayurveda. There is no any drug mentioned in Ayurveda with this unique concept of drug consumptions with a different anupan in different season, except Terminalia chebula, called as the Ritu Haritaki. Anupan facilitated the bioavailability as well as relieve the side effects of medicine. They can also serve as a catalytic agent like as that is Yogavahi. They help to direct effect of the medicine to the deeper and subtle tissues of the body. Ritu means a season, Charya means a guidelines. It is the seasonal guideline for living. According to our Acharya's movement of the sun is responsible for the different type of ritus. Ritu, to attend the vitalizing actions of Haritaki, it should be taken with different additives. Anupan is very important factor which help in absorptions, assimilation as well as it help in enhancement of efficacy of the particular drug. Anusah pashyatavadiyate iti anupanam. Anupana are described along with the food stuff as well as medications under different conditions. They are having a simplest to the obscure function in the different way. This is the introductions regarding the Sindhu Sharkara Shunthi, Kana Madhu Gudai Kramatah, Varshadi Abhaya Prasha Rasan Guna Eshaha. This is a systematic review of literature from the database, mesh term, search strategy, selection processes, limit and restrictions that importance is given to the studies conducted within the 15 years only, search filter and total recorded. We have get the trial registry, regulatory document, clinical study. Then research article included. There are 88 total articles were included. This is Prisma flow charts. Directly we go for the nature of knowledge gap, that is empirical gap, that only literature was available on the Ritu Haritaki. No clinical study was performed. Efficacy of Rasayan as a Ritu Haritaki and adjunct Haritaki as a disorder of Varsha Ritu. So this is the basic of the study. Acharya Sharangdar mentioned that just as a drop of oil quickly spread over the water, like that of medicine spread in the body, that Anupan. Haritaki with the Sharkara does purification or provoke the Pitta due to its Snigdha Guna and Madhura Rasa and Vipaka. By this, Pitta get purified. The study to assess the viability with and without Sharkara through plasma study has a different interval. Research question: whether empirical evidences in the favor of substantiation can be generated in the concept of Ritu Haritaki with Sharkara as Anupan through the assessment of observability. This is a general hypothesis, generated hypothesis, and null hypothesis. Aim to evaluate the efficacy, viability, enhancer effect of Sharkar as an upan with Haritaki. Primary objectives to evaluate the viability of Haritaki without Khanda Sharkara as an upan, to evaluate the viability of Haritaki with Khanda Sharkara as an upan, and to compare the both A and B. These are the secondary objectives to assess the Chebulinic and Chebulinic chemical constituent drug by using HPLC diode detector, and to assess the Chebulinic and Chebulinic chemical constituent of the drug with anupan by using HPLC diode array detector techniques. This is research design, that study type interventional and analytical study design, randomized clinical trial, commensurate sample size. Before initiating work, a pilot study was carried out and sample size were decided on that basis. Sample size will be decided according to the sample size and its power, that is 80. Power is more for the viability, it is 85 to 80. That is, we have to collect the samples 30 or 26. Sample size calculation is carried out. 20 healthy volunteers were selected in the both group Haritaki Kwat and Haritaki Kwat Khanda without Sharkara. 10 patient in both group, that is group A and group B. Observation pilot study, it has been reported that the chebulinic and chebulic acid are the main phytoconstituent of terminal chebula. Therefore, prior to the HPLC analysis, the UV spectroscopy of a chebulinic and chebulic acid was performed. In the result, both the selected acid shown almost similar absorbance. The calculated lambda max for the both polyphenolic acid are 280 and 220 nm. Importantly, between these lambda max value 220 nm display quite strong exorbance. This is the variances. This is the total study of the a study plan, that Haritaki Kwad having a 50 patients, group B have also having the 10 patient with having the 50 samples. Material identification and authentication of the Haritaki fruit will be done from the FRLST and received from the FRLST number. Then heparin vacuum EDTA bulb will be collected. High performance liquid chromatography of Schemadu inbuilt with the binary pump UV detector. Redonine 20 microliter loop capacity manual injectors were used throughout the analysis. This is material EDTA bulb and Savlon medicated cotton bands purchase. This is the healthy volunteers where the blood will be collected. Sample collected after the interval period. Method: standard stock solution of selected flavonoids, garangin, rutin, myrcene, creatine, curtisin, and chebulic acid, prepared individually of concentration of 1000 ppm. Mix in a solvent, acetonitrate methanol water in ratio of 2:2:1. The two get the 100 ppm concentration of each flavonoid. Extraction of the crude sample. In this process, we have to extract the crude samples. Inclusion and exclusion criteria. Inclusion criteria: volunteers of sex age group between 20 to 40 years, liver function test with the normal value, renal function test with the normal value, lipid profile with the normal value, and blood report within the normal limit. Exclusion: volunteers with any medication or any acute or chronic disease will be excluded. History of the drugs or the alcohol abuse, liver, kidney disorders, hypertension, diabetes, and BMI index less than 18.5 and more than 24. These are the some of the certificate of the quality standard control parameters and the authentication. In this way, we have to prepare the Haritaki Kwat. Haritaki Kwat, then Anupan is 24 gram. Sharkara as Anupan was given along with the Haritaki Kwat. Dose 2 per period of intervention, M system. Patient consignment, plasma sample preparation, and plasma drug recovery. This is the sample size of group. That blood collections will be done on the initial 0, 180 minute, 360 minute, 540 minute, and 720 minutes. Collagen and collection of the data. The enrollment of the patient, age-wise distribution of the patient. Enrollment of the period in a month of Sharad Rutu, basically from September to November, we have to collect the data. Marital status. This is the mean area of observability in both group and group B. We're showing that the group A having less or as compared to the group B. In these also, mean concentration absorbability also showing that the group A having lower concentration rather than in compared with the group B. In these, there is a frequency distribution of the absorbability in both group and group B. This is the graphical representation of the concentration of Haritaki without Anupan in healthy volunteer, that is group A. This is group B, Haritaki with Anupan. in healthy volunteers. Analysis, it has been reported that cebulic and cebulonic acid are the main phytoconstituent of terminal cebula. Therefore, prior to the HPLC analysis, the UV spectroscopy of the cebulonic and cebulic acid was performed. These are some of the graph of HPLC analysis. This is the plasma sample HPLC. Then this is the standard HPLC of the cebulonic acid. This is the HPLC of the quatha. This is plasma along with the quatha. This is primary objective, their inferences and the justification. There is some of the strength and weakness and challenges and opportunity to these studies. Limitations of the present studies are that it is observed that concept of viability enhancing effect of Anupan in Ayurveda is only documented. However, there is no any recent research or scientific literature practical proof either synergistic effect or any other interaction on the viability of Haritaki. Hence, this kind of innovative study will prove the Anupan concept in Ayurveda. Conclusion and summary. Previous study have reported quantification and determination of the phytoconstituent from the hydroalcoholic vata of terminal cebula. Importantly, few of them have attempted the animal studies. However, after comprehensive literature survey, to the best of my knowledge, no one has performed the characterization and quantification of derived metabolite from the terminal cebula. These are the some of the references. Thank you.
Thank you, doctor.
Thank you.
Thank you for your dynamic and detailed presentation. Your energy and clarity in explanation were truly appreciated.
Thank
you. Next we can go with our next presentation. So I would like to invite Dr. Nikita Sitaram Shelke.
Okay, hello ma'am. Good evening.
Good evening, doctor.
Good evening, sir. Hello?
Yes, doctor. Can you please share the screen, doctor?
Yeah.
Okay, doctor, your screen is visible. Please start the session, doctor. Doctor, please unmute, doctor. Your audio is not visible, not clear, doctor. Please unmute, doctor.
Yes, sir.
Okay. And please start the session, doctor.
Hello, good evening, sir. Myself, Dr. Nikita Sheke, MD Scholar, Kriya Sharir from Sumati Baisha Ayurved Mahavidyalay. As I'm not feeling well, so please adjust with my voice. My topic name is Roga Sarvayapi Mandagne under the guidance of Vaishali Bhosle ma'am and HOD Pranita Joshi ma'am. Abstract. The creation and destruction of the universe, metabolism and catabolism in organism, all are regulated through Agni. The presence of Agni in human system is responsible for digestion and metabolism. Agni digests the ahar, that is food, on which the strength of the body, varna, oja, etc. depends. Hypofunctioning of Agni leads to indigestion and formation of armor, which in the turns is the root cause of various alignments. Meanwhile, hyperfunctioning leads to the several other digestive as well as generalized metabolic anomalies. Agni is the most important aspect of Ayurveda, as all the states diseased or health revolves around the status of Agni. Agni encompasses all the changes, include the digestion and absorption of food, cellular transformation, and assimilation of sensory perceptions, mental and emotional experiences. Introduction. In Ayurveda, the term Agni is used in the sense of digestion of food and metabolism. Agni is one of the 10 factors which are required to be examined before initiating the treatment of patients. Agni is responsible for absorbing the nutrients and essential elements the body needs while burning of waste products. If our Agni is strong, we are able to digest food efficiently and easily. On the other hand, if Agni is weak, our body won't digest the ingested food item well, creating toxic residue or armor that lodges deep in our cells. If digestive fire is not functioning properly, one has poor digestion, poor complexions, low energy levels, flatulence, and poor immunity against disease. Thus, according to Ayurveda, principles promoting proper functioning of the digestive fire is the main key of treating the root cause of the disease. Agni in various literatures. According to Charak Chikitsa San 15, Acharya Charak mentioned that after cessation of the functioning of Agni, the individual dies, and when the Agni of an individual is summer, then that person would be absolutely healthy and would lead a long, healthy life. If somehow the Agni of the person is disturbed, either whited or diminished, the whole metabolism of the body would be disturbed, resulting in the ill healthy and diseased state. That's why Agni is said to be the mool, that is base of the life. According to Shushruta Sutristan 2109, according to Acharya Shushruta, there is no other form of Agni in the body except the Pitta. When this Pitta dosh is whited or diminished, the digestion of the food material is affected. According to Chakrapani Tika, on Charak Shushruta, Chakrapani has commented on the function of Pitta inside the body is not combustion, but its work is to provide heat energy of the Agni. According to Ashtanga Hruday, according to Hemadri, Pitta is of 5 divisions, which is located in the middle of the Pakvasha and Amasha. Although it is composed of Panchamahabhutas, because of an increase of Teja Bhut, it is devoid of liquidity. Also, because it does not possess Snigdha, Shita, and such other properties of Apamahabhut, it is called as anal. Because of its function of paka, it cooks the food, divided it into essence and waste separately. The Jataragni helps to the other pitta in the body and to the Dhatvagni present in the Dhatu. Types of Agni. According to Charak, there are 13 types of Agni. Jataragni, 1 Jataragni, Bhutagni 5, and Dhatvagni 7. According to Shushrut, there are 5 Agnis. According to Vagbhad, there are 18 Agnis. According to Sharangdar, there are 5 Agnis. And according to Bhav Mishra, there are 13 Agnis. Jataragni. The strength of Grahani is from Agni itself, and the strength of the Agni is from Grahani. When the Agni undergoes vitation, Grahani also gets vited and produces diseases. Jataragni is Agni present in the Jatara. Jatara stands for the stomach and duodenum. As per Ashtang Hruday, site of Jataragni is Grahani. The name Grahani, as it holds the food for a certain amount of time inside the amashay in order to initiate the digestion. Samagni. Normal digestive fire is characterized by strong and appealing appetite that is easily satisfied with normal food. Digestive functions are proper. There are no episodes of gas, colic, and constipation. It digests and assimilates food properly at the proper time. This thus increases the quality of dhatus. Vishamagni. Here, the digestive fire is disturbed by Vata. Because of variability in Vata, there are episodes of alternative cycles of a strong aptitude with loss of appetite and forgetfulness to consume food. Tikshnagni. Here, the digestive fire is disturbed by Pitta. In this case, Agni is usually high, and both Pitta and Agni share same properties. Mandagni. Tikshnagni, when food is digested, the throat, the mouth cavity, and the lips becomes dry with a burning sensation. This condition is known as Bhasmak Roga, according to Ayurveda. Mandagni, Manda means slow. Here the digestive fire is disturbed by kapha. Because of variability in kapha, there are episodes of poor appetite, sluggish metabolism, and tendency to weight gain despite optimal food consumption. The meaning of the Mandagni is slow digestion, power of digestive capacity. According to Harit Samhita, Samagni depends on whether the dosha, that is Vata, Pitta, and Kapha, are in normal state. When the Pitta is higher than normal, the condition is known as Tikshnagni. When Vata and Kapha are higher than normal, the condition is known as Mandagni. Bhautik Agni, there are 5 Agnis, that is according to Prithvi, Apit, Teja, Vayavya, and Akasha. Dhatvagni. Dhatvagni are according to our dhatus, that is Rasa Dhatu, Rakta Dhatu, Mans Dhatu, Med Dhatu, Asti Dhatu, Majja Dhatu, and Shukra Dhatu. Conclusion. Agni, apart from the digestive function, is also responsible for the production of strength, which has two aspects, namely strength to resist the occurrence of disease and decay in the human body, strength to perform physical exercise. Due to faulty Agni status, a number of unripe, undigested, or unmetabolized products are formed and have tendency to block the microchannels of the body, thus resulting in accumulation of dosha and finally precipitate in the form of disease. Ayurveda emphasizes that most of the diseases are the byproducts of Agni Dhatu. That is why Agni Dushti, that is why the main principle of treatment of all the diseases in Ayurveda. These are the references. Thank you.
Thank you, doctor.
Thank you, doctor. So next, I would like to invite Dr. Charushila Ramesh Kalokhe. I invite Dr. Charushila.
Dr. Charishila, are you there? Please unmute, doctor.
Yes, sir.
Okay, doctor. Good evening, doctor.
Good evening, everyone.
And please share screen,
Please.
doctor.
Yes, sir. May I please share my poster?
Okay, doctor. Just a moment. I will share for you. And please start the session, doctor.
Yes, thank you, sir. Good evening, everyone. Myself, Dr. Charushila. Am I audible?
Yes, doctor. Audible. Please continue, doctor.
Good evening, everyone. Myself, Dr. Charushila. I am third year, final year student of MD, MS, Prasiddhantra and Sri Rog from Sani Guruji Ayurved Mahavidyalaya, Hadapsar, Sumatibai Shah Ayurved Mahavidyalaya. Today, I am going to present topic related to Garbhini Paricharya in Ayurveda. According to modern science, antenatal care is correlated with the Garbhini Paricharya, as Garbhini is considered as a Telam Eva Patra, means as soft as a part container containing tail. That's why in Ayurveda, Garbhini is given mostly importance. In Ayurveda, Garbhini Paricharya describes the normal dietetics and mode of life of pregnant woman. Ayurveda, there is a concept of Dorudya, in which in which Ayurveda said that there is correlation between the hearts of mother and the heart, mother and the fetus, because whatever mother is eating, from that food, digestion occurred, and from that food, whichever nutrition comes, go to the fetus. That's why any kind of food or diet which female take has effect on the fetus. That's why in Ayurveda, diet of the female as well as the behavior of female is very important for the proper growth of the fetus. That's why in Ayurveda, Garbhini Paricharya aims for proper development of the fetus, for health of the mother. It with held the strength of labor. Like Charaka, Sushruta, and Harita described various kinds of regimens according to month. In Garbha, when we come in practice, we see there are many causes which leads to abortion and recurrent pregnancy loss in pregnant females. That are the bhavas which cause ghata, means which destroy the garbha. In Garbhastapak Aushadhi, there are some drugs which are prescribed by acharyas, which are useful for maintaining the proper growth and maintaining the further pregnancy of the lady. First of all, I am going to discuss the Masanamasic Pathya by various acharyas. According to Charakacharyas described various kinds of residents according to various months of pregnant women. In first month, Charakacharya described non-medicated milk. In second month, Madhuras medicated milk. In third month, milk with honey and gruit. In fourth month, milk with butter. In fifth month, Shira Sarki. In sixth month, Madhuras medicated gruit. In seventh month, Madhuras medicated gruit. In eighth month, rice gruel with milk and gruit, that is Shiriyavago. In 9 months, Madhuras, Anvasan Basti and vaginal tampon. In Shushtur, Saita, Visvitacharya described in first, second, and third month, sweet, cold, and liquid diet, Madhushita and Dravahar. In fourth month, Shushutacharya described curd, rice, milk, butter, and meat. In fifth month, Gokshuru Yukta Grut or rice gruel in 6 months. In seventh month, medicated grut with Prithvika, and in 8 month, Astapan Basti. According to Haritacharya described Madhu Yashti, Parushak, and Madhu Pushpa with butter and honey in first month. In second month, Kakuli Siddha milk. In third month, Krishna. In fourth month, medicated crocodiles. In fifth month, Payas. In sixth month, curd sweetened. And in seventh month, Grut Kanda. In eighth month, Grut Purak. And in 9 months, cereals were described. As we discuss about all these Masanamasic Pathya, we come to recognize that these all are Grihani and Jivdiyana Aushadhi, which are required for proper growth of Garbha, because Garbha is developing part during the pregnancy. All these are Madhur Rasa Dravya. In Garbha Stafak Aushadhi, described by various acharyas, Indri, Brahmi, Shatvirya, Sastravirya, Amoga, Avyatha, Shiva, Arishta, Vatya, Pushti, Vishwaksen Kanta, described as Garbhastapak Aushadhi. Charakacharya described these as Prajastapan Aushadhis, which can prevent the abortion and recurrent pregnancy loss. Mother should take a bath from water which is medicated by these dravyas. Secondly, Vagbhatacharya also described all these dravyas as Garbhasrapan dravyas, and Vagbhatacharya described it for carrying this dravya on the head or on right hand by the mother. Mother should take bath on Pushya Nakshatra by medicated water of these dravyas. Kashyapacharya also described all these drugs for use in pregnancy. Chakrapani described these drugs for effect of harmful actors on the fetus. Hindu Acharya described these dravyas to prevent abortion, and Kashyapacharya describes for daily use to promote the proper health of fetus and mother. Amulet of Trivruta. Trivrut money should also be tied in waist of pregnant women, which can act as Garbhastapak. All these Garbhastapak Aushadhis are useful for maintaining the pregnancy and mainly described for avoiding abortion and recurrent pregnancy loss. In Garbha, when we come to practice, we see that there are various patients who are still practicing these Garbhavs during pregnancy, which can lead to the pregnancy loss and abortion. In Charakacharya, pungent drugs are described as Garbhav. Exercise, excessive exercise can lead to the Garbhaghat. Coitus can lead to the Garbhaghat. Shushutacharya described coitus, exercise, excessive emaciation, sleeping in day, that is divasa, awakening in the night, grief, shock, riding on the vehicle, fear, sweating, oleation, bloodletting, separation of natural urges. All are responsible for distortion of the Garbha. Ashtanga Sangraha has described Panchat drugs, exercise, coitus, excessive emaciation, sleeping in day, awakening in night, grief, riding on vehicle, fear, sweating, ovulation, bloodletting, separation of natural urges, indigestion, prolonged stay in hot sun or near fire. Ashtanga Hridayacharya has described quietus exercise, carrying heavy weights, squatting, grief, anger, excitement, separation of natural urges, fasting, excessive walking, use of wine and meat, use of spicy food, etc. Kashyapacharya has described erect or flexed position for long period, excessive laughing, trauma, seen setting sun, solar or lunar eclipse, and misbehave with a guest. All these are described as Garpotkatukar Bhav. As we observe all these bhava, we come to know by the following or by doing all these bhava, there is a recurrent increase in the vata. Vata prakop can happen and it can lead to abortion. Along with there are some blood dating and prolonged stay in hot sun or near fire can cause pitta prakop, which can also lead to the garbhotpat. In such a way, Ayurveda Garbhini Paricharya has described.
Thank you, Dr. Charishila. Thank you for the well-explained poster presentation. Thank you so much.
Yep. Welcome, sir.
We have come up to the approximate end of third day of Prithvika National Seminar presentation. Next, I invite Dr. Pooja. Dr. Pooja is there? Dr. Pooja, are you available in this seminar? Next, I invite Dr. Sonudai Madhavrao Shinde. Dr. Sonudai, are you there? Okay, next I invite Dr. Divya Dattaram Baikar. Dr. Divya Dattaram Baikar, are you there? And next I invite Dr. Shidal Papat Palve. Shidal Papat Palve, are you there? And next I invite Dr. Shubhankar Kulkarni. Dr. Shubhankar Kulkarni, are you there? And finally I invite Dr. Ravindra Kumar. Dr. Ravindra Kumar, are you there? So we are come up to the end of the session. I would like to invite Dr. Aishwarya to conclude the session.
Thank you, Dr. Sabi. So thus we come up to the third day, and this is not the end. On behalf of Team Ayurveda, I extend my heartfelt gratitude to each one of you for your for gracing us with your presence and support throughout this presentation. And especially, we are immensely grateful to our esteemed faculty for their guidance and continuous encouragement. So, before ending this session, I am delighted to announce that due to the demand of our participant, we have decided to extend the presentation on 22nd March 2024, and we look forward to further discussions and presentation, active participation from each one of you. Once again, thank you all for your invaluable support and participation. Let's continue to thrive for excellence together.